Good morning. Welcome to the final day of CCN's Annual Conference. May we please ask you to take your seats.
Okay, I'm being given the thumbs up from the back of the room to say that our microphones are live, so I better make sure that I'm only saying the things I'm supposed to be saying from now on. Welcome back this morning. Thank you. Congratulations to everyone who has made it for nearly 9 o'clock. It's great to see you all this morning, and I'm hoping that some more of our group will drift in during the course of this session, which is going to be a really good one. I'm Lucy Nethsinger. I'm the leader of Cambridgeshire County Council, and I'm delighted to be back here again, welcoming an amazing panel to talk about health and social care this morning. There is a renewed focus on prevention through the neighbourhood health agenda, but adult social care has long been about ensuring people lead independent and meaningful lives within their communities. Since the Care Act was enacted, local authorities have had duties to promote well-being, to consider whether people could benefit from a preventative service, and to ensure the provision of services that prevent, reduce and delay the need for care and support. But these duties were largely a formalisation of the approaches that local authorities had been taking for a long time. The Casey Commission is now looking at the future of adult social care, with the aim of making it more productive, preventative and person-centred. At the County Councils Network, we've done a lot of work to consider what this might look like, much of it in partnership with Newton. And Danny will share the reflections on some of the opportunities we are promoting to Baroness Casey and her team. There is also a national focus on neighbourhood health as a mechanism to expedite some of the shifts we have long been aiming for with health partners, towards prevention, closer to home, and partnership with communities. Nigel is going to reflect on what we've learnt from previous efforts to progress these shifts, what has worked well and less well, and how we can build on this learning rather than reinventing the wheel. County areas, with their responsibilities to include adult social care, public health, transport and place shaping, hold many of the levers that will determine the legacy of the neighbourhood health agenda. Sir John will reflect on his experience as a recent leader in this work, including on the specific role and opportunities of local authorities. And I'm delighted that we are joined by such well-informed experts, and I will hand over to Dan. Thank you.
Great. So good morning, everyone, and thanks for inviting us to speak today. So as we said in the introduction, at Newton we've had the opportunity to work with a number of county councils, 50 or so local authorities in total, and together have built a really rich evidence base around what works locally in adult social care. Building on that body of work, we've partnered then with the CCN to produce a number of different pieces of research, including thought on how to optimise social care delivery sort of overall to improve benefits for people and financial sustainability. We've done deep dives into the interface with the NHS, deep dives into working age adults, and more recently been working on the implications of local government reorganisation and reform on people's services. We also carried out an analysis of the latest incarnation of the DIL-NOT cap on care and updated means test a few years ago. And it's all of that work that I'm going to just draw on for some comments to introduce us today. I'll just begin with a very brief stock take of what we can see happening on the ground at the moment in adult social care, set out some of the scope and opportunities for change and reform, and then based on this work, draw out some examples that we can see having great impact locally and think about what we might need to do to scale those up through things like Baroness Casey's Commission, through integrated neighbourhood health, and think about some of those key recommendations that we'd like to see be taken forward. But just to begin with a stock take then, where are we in adult social care currently? Well, to start, I suppose, with the money. Since 2020, we've seen just over 50% growth in the net commission spend on adult social care. And you can see from the analysis on the page that that's significantly outstripped inflation and has outstripped growth in minimum wage. So yes, inflation has had a significant impact on that, but there's a lot more there going on, both rising demand and increasing prices over and above that. And we know that in that time period, core spending power that we've had within local government hasn't kept up with that level of growth in spend. We also know that we have a significantly ageing population. Between 2011 and 2024, the number of over 85s increased by 25%. we expect over the next 20 years that number is going to increase by a further 75%. So in effect will have doubled since 2011. What's perhaps less often talked about in these sorts of conversations is working age people who draw on social care. Those groups of people now make up, getting on for 2/3 of the money that we spend on social care, so 63%, supporting people of working age and with lifelong disabilities. I'd say to some that might be unexpected because often the debate really is focused on older people and frailty. And those of you that were in the session on SEND yesterday will have seen those rising numbers of young people with the HCPs. Well, we know now to expect roughly 1 in 5 of those young people to meet the threshold for adult social care as they transition into adulthood. So again, we can see further demand coming through the system there. I think that also raises a question about the 4 in 5 who don't meet the threshold and how we might provide support to those people. So given that kind of rising demand, rising costs, that really raises the question of prevention. And we're seeing some really significant innovation around that locally, and I'll touch on some of that as we get through the rest of this session. But I think it's right that we see a lot of innovation going on there, given this picture of rising prices and rising demand. So what scope do we have then for reform and change in adult social care? Well, I think firstly, the temptation can be to reach for a change in the model of funding. So we saw this a couple of years ago, the sort of latest attempt at reintroducing updating the means test and introducing the cap on care, and ultimately that failed in part due to it being unaffordable. But I guess we would say that we would want reform of adult social care to be much broader than that and to broadly consider 3 things. So eligibility. Given some of those figures I shared in terms of the rising demand, if we believe that that's what we're sort of heading towards, we have to enter into debate about what we're trying to provide, who we're trying to support, and what can residents expect from state-funded adult social care. Second is funding. We need to think about funding and what's the balance between personal wealth, the private market, and state-funded care. And then thirdly, delivery. So how are services delivered effectively and efficiently in a way which delivers good outcomes, good careers for staff, and at good value for money. And this is largely where a lot of what we share today will be focused. So in terms of the opportunities for change coming down the line, well, we've got Baroness Casey's Commission, as you'll all know. Phase 1 of that's due to report next year, likely to focus on a national care service, working age adults, eligibility for care, and interfaces with the NHS. We've already got the NHS 10-year plan with its shifts from treatment to prevention, hospital to community, and analogue to digital, and neighbourhood health as the key means of delivering all of that, alongside some quite challenging organisational changes we'll all be aware of. We're seeing the CQC inspection regime bedding in, so getting on for about half local authorities now have received their inspection reports. We're seeing themes starting to emerge, some consistent themes starting to emerge from that, including support for unpaid carers, quality and timeliness of assessments, building a greater understanding of populations to support co-design and prevention, and some recruitment challenges as well. I've touched on local government reorganisation. That could have a really profound effect on adult social care if we're thinking about significant levels of aggregation and disaggregation. There are significant risks and opportunities to be realised in terms of risk to cost and quality as we disaggregate, but also the opportunities of bringing in housing and bringing in some of the functions of lower tier local government. And then I think lastly, some of the adjacent reforms going on in the sector, so reform to SEND, reform to children's safeguarding as two perhaps obvious ones, and understanding the connection that they're likely to have to adult social care. So I think the opportunity we have is to set out a kind of coherent picture and a coherent set of changes to be delivered across all of those moving parts. As we start to sort of think that through, what we're going to try to focus on is what we can see as examples of really brilliant locally led change and impact already happening, and think about how do we use all of those different bits to accelerate and scale that up without being overly reliant on kind of big top-down policy change. So we're not worrying too much about the definition of things like integrated neighbourhood health or the exact scope of the commission. We want to focus on where we can see evidence of impact locally and think about what we could do to scale that up. So just to move on then to some specifics. Apologies, click through that. Not been keeping my slides up to date. There we go. So just to move on to some specifics, we're going to draw on 3 major themes that we've been embracing through our work together. Working age adults, working with the NHS around intermediate care and hospital discharge, and early intervention and prevention. So in terms of working age adults, I've already said 63% of net adult social care commission spend is spent on people of working age with lifelong disabilities. We've seen in recent years the average per person spend increase by about a third since 2020. So that's faster than the rate of inflation and faster than the rate of minimum wage growth. So we can see we're spending more per person as well as seeing rising demand. But at the same time, we can see that outcomes aren't improving. So life expectancy for somebody drawing on social care as a working age person or with a lifelong disability is 20 years shorter than if you don't have a disability. Working age people are 2.7 times more likely to leave education with no qualification. And only 4.8% of people known to the local authority and being supported with a learning disability are in paid employment, despite 86% reporting that they would like to be. So we can see a picture of rising cost and perhaps not the outcomes that we'd want to be achieving. But again, we can see, in county councils, we can see brilliant locally led change. We can see better pathways being developed for young people with disabilities that prepare for adulthood. We can see a real shift in practice going on around how we review and support people of working age, prioritising independence, empowerment, skill development, seeking opportunities to progress to more independent settings and more independent ways of living. And really important to that is tackling productivity to increase the capacity to do that more in-depth, independence-focused work. So some examples, one county council seeing cost reductions of nearly £500 a week of people transitioning through to adulthood, planning for adulthood 2.5 years earlier, doubling team productivity to be able to carry out twice as much of that independence-focused work. We can see real evidence and examples of that working locally. So then how do we think about scaling that up? We have to have the conversation about working age adults and delivering better outcomes for working age people needs to be trying to keep my focus. This needs to be a better part of the national debate. We'll get there. So delivering better outcomes for working age people needs to be a better part and a more central part of the national debate on adult social care. And we're really pleased that it's formed such a part of Louise Casey's scope for the first phase of the Commission. We need to be clear what good outcomes look like for these cohorts of people. And we need to be better at collecting and reporting on data to know whether we're achieving this. Data collection around our support to working age people is really poor and really inconsistent. We need better housing solutions for disabled people, for disabled adults, moving away from a reliance on 24-hour residential and nursing placements, which are quite restrictive and don't promote independence. And we really need that significant focus on joint work between adults and children. And we think if we can do all of that, there are over 11,000 people that could be living more independently, could be living in more independent settings, out of residential homes and into their communities. Second area of focus, working with the NHS on hospital discharge. Current state of affairs then. So emergency admissions have returned to pre-pandemic levels for older people. I think perhaps most stark is that older people are spending over a third longer in hospital when they're admitted in an emergency. So nearly 35% longer than back before the pandemic. And we can see a consequential increase in long-term care and support needs. So we've seen 8% more people being discharged into long-term care over that time period. So lots more activity, but we also know that we're not currently getting that right. So we're seeing 30% of admissions of older people are deemed avoidable or inappropriate. And somewhere between 20 and 45% of people are leaving hospital not on the right or the ideal kind of long-term outcome, so not in the situation that would best promote their independence. Again, what we're seeing happening locally, well, our national analysis tells us that really effective reablement services as a step down from a stay in an acute hospital can deliver a 7-to-1 return on investment. And we can also see that there are nationally twice as many people could benefit from those services if they were available and if we were referring them. And we're seeing that achieved locally through significant culture change, more efficient ways of working, challenging resource allocation, challenging exclusion criteria, and taking a service-wide approach to performance management. And really importantly, investing in therapists and occupational therapists who are a critical part of that team. Again, example results from a county council, increasing appropriate people who are working with by 64%, 17% reduction in ongoing care and support. That's worth about £8 million to that county council. So really significant local impact that can be had by getting this right. How do we scale that up? Well, comprehensive data visibility is a really important thing in integrated working. We often see that we don't quite know, but when we're working between local government and the NHS, what the biggest issues are. It's often about who shouts the loudest. We need an equal focus on prevention of admissions as much as on optimising discharge. And we really need to focus building the capacity of that home-based intermediate care, things like reablement services. I think just about every county in their annual returns report the need for more capacity in services like reablement. If we can scale that impact up, we could see 175,000 fewer older people admitted to hospital every year. That would save the NHS 600 million. We could see hundreds of thousands of older people living more independently in the long term if they could leave hospital on the right pathway and get access to some of that intermediate care. Lastly, then, early identification and prevention. So I've already said, in the next 20 years, we expect that the number of 85 plus in our population will increase by nearly 3/4. That trajectory is going to be unsustainable unless we can have a more fundamental shift towards working proactively and preventatively. I think, as we've already said, the Care Act sort of sets out a way to think about prevention for us in terms of primary prevention aimed at people that don't yet have sort of presenting need, that we want to prevent or minimise that from happening. Secondary prevention, being more targeted, where we can see that someone has an increased risk, where we want to delay that onset and reduce the impact. And then tertiary prevention, where we can see that someone has an established set of needs, and we're looking at managing that need or delaying the escalation of it. And we're starting to see counties having real success, particularly around primary and secondary prevention. So using connected data to build a view of residents and then use artificial intelligence to predict who's likely to need social care before they need it. So things like who's likely to have a fall, good example. And then use that information to provide really tailored interventions and make best use of the range of universal services that are already available through both the council, the NHS and the voluntary sector. Again, example results from a county council, nearly a 10-fold reduction in fracture rate from people who've been identified as at risk of a fall, saving £175 a week and saving in total the council up to £8 million and more again to the NHS. Thinking about how would we scale that up and what could we consider through reform, the ability to think multi-year with investment is really important and creating incentive structures that mean we can invest upstream and we're incentivised to do that. Investment in integrated data, really important, to enable that predictive analytic and use of AI to be able to see who's likely to be at risk of different things. And taking a coordinated approach to tackle the wider determinants of health, and local government has a really key role in that. So that's both local and national, thinking about housing, transport, employment, benefits, social care, healthcare. Again, if we can scale that impact up, we think 3-to-1 return on investment would be typical for a well-designed preventative intervention. So there's billions of potential there if we can get it right. But we do need a greater evidence base, and we're working now with about 20 councils to build a bigger and more robust evidence base around this through a multi-council pilot. So reasons to be cheerful, reasons to be optimistic. We think local government can really deliver on a lot of this and are doing already. Hopefully we've seen that through some of the examples that we've shared. Particularly around neighbourhoods, local government's uniquely positioned to connect the dots between different services, adults, leisure, housing, social care, and the NHS, and deliver that more preventative offer. I think prevention really is the sustainable route through, and we can see evidence now that it really is working locally. The question is, how do we scale it up consistently? And if we can do all of that, it means a better life. It means better lives for residents, avoiding crises, living longer in our own homes, living the lives people want to live. And if we can take that focus on prevention and independence, it provides a genuine route to financial sustainability. At that point, I'm going to hand to Nigel.
Thanks very much. We've been trying to do, looking back, it probably is more than 20 years of talking about it. Maybe 25, 30. It depends where you date it from. And I won't give you a history of it, because many of you will be familiar with large numbers of initiatives, many of which seem to come and go quite quickly, and I'll come back to that theme. Later. But we do know quite a lot about what's been happening, and I thought we could perhaps try and draw some lessons from all of that. The first is, I don't know if you're aware of this, there are 170 plus definitions of integration in the academic literature. So there's actually a problem with the term. It's quite slippery, and actually when people are talking about it, they're not very clear about what it is they actually mean. I mean, I think a much more helpful way to think about it is really about reducing the fragmentation that is experienced by the people who use services, the extent to which the service providers are properly coordinated, that there is alignment on objectives, that there are systems and processes that are also aligned and supporting them. But that term gets missed, and one of the big lessons is there's not been enough focus on that. I'll return to that theme later. The second problem is that the NHS particularly has tended to define integration in terms that relate to the goals of the NHS. And that, in the most recent planning guidance and the guidance on neighbourhood health that many of you may have seen, the NHS has had an absolute epidemic of guidance recently. It's quite hard to keep up with it. Maybe the massive reduction in the central post will mean some letting up in the stream of stuff that comes. But there is a problem with, I think, of saying to people in primary care, people who work in social care, your job is to keep people out of hospital. And it's the wrong framing. It might be better to say, healthy life expectancy in many areas is lower than retirement age. Perhaps you should focus on that. By the way, if you do that, that may well have a positive impact on the hospitals. But to say to people whose main job is not looking after the hospital, please help us look after the hospital, I think is a poor framing. So I think there's an important lesson there, which we haven't learned, which is a problem. The second problem here is, I'll tell you a little story about Daisy Hill Hospital in Northern Ireland. They had a emergency department corridor and same-day emergency unit, full of patients sitting there who should be in bed. So when they lost their surgical trainees and had to close their surgical beds, they said, I know, we'll put our the patients into those surgical beds so there's no more queue in the emergency department. Those of you who've worked in healthcare will know what happened. 3 months later, those 20 beds are full, and there's a queue of patients sitting in the emergency department and in the corridors because the threshold for admission to hospital in this country has got a lot higher, and there's a lot of people who you could admit if you have the capacity. So we found it, we can definitely prevent the admission of individual patients, but one of the lessons is unless you control the front door of the hospital and reduce the capacity in line with that, there's a famous article from the early 60s, a bed built is a bed filled. The beds will fill up. It's like opening an additional lane on the M25. You know, it's great for 6 weeks. After that, it's back to how it was. There's just now 4 lanes of traffic, not 3. So there's a big issue here. The other problem is that we haven't really sorted out the financial engineering of the NHS is very short term. And many of the costs in hospitals are fixed. So you'll see in the NHS plan, if we transfer patients from hospital to hospital at home, we save X £100 per day. Well, the reality is you don't. You have to shut the hospital. You have to shut the whole hospital, not a bit of it. So there's a real problem. You have to have a 3 to 5 year time horizon to adjust your cost base. The NHS has proved very bad at doing that, and they need some help on that. The third lesson here is, I think, there's too much focus on frailty and not enough on people with 1 or 2 or 3 multiple sort of long-term conditions. There's much more we can do for them. Frail people are important, and there's things that we can do to help, and there's a lot around supporting nursing homes and end-of-life planning that will make a difference, but there's too much, there has been, I think, not enough focus on the larger numbers of people who are in sort of, whose risk is rising, but are some way off frailty. Big lesson, I think, which the NHS hasn't learned, which is the potential for hyper-local voluntary service involvement and the mobilisation of communities. And lessons from other countries with successful integration, particularly an interesting model in Alaska, also in New Zealand, is much more that can be done to do that. And actually, of course, local government tends to be much better at having those conversations than the NHS. Again, the NHS tend to frame, what can you do for us? Whereas actually what we should be doing is, what can we do for you to support you as a community? So I think there's a big and important lesson there, but particularly in the area of prevention. dealing with loneliness and worklessness, particularly sort of young people in transition from education into adulthood. Lots to do there, and some great examples, often local authority led, of how this has been fostered, and how to foster it without the weight of the state bureaucracy swamping these small hyper-local organisations who can't write tenders and go through all of the procurement and spreadsheet completion that the NHS is particularly fond of. We've also learned that rural areas don't have the same models as urban areas. Well, we've learned that, but it doesn't actually seem to have translated into policy. There's a tendency to say we'll have the same models in rural areas as we do in local areas. Another lesson here is that the cost of providing services in rural areas are not generally recognised in the way that the funding flows in either local government or in health. And of course, many of the problems are not just health problems, they are transport and social infrastructure and social capital problems. And I think there's not been enough emphasis in terms of how we develop these models on the surrounding infrastructures to support particularly rural areas. So more to do there. And incidentally, a particular problem in the UK is our areas aren't rural enough to have some of the solutions that you can get away with in very rural areas. We're in a sort of slightly awkward zone there. There is so much focus on governance and structures. The NHS particularly is bad at that, but actually if you look at most of the initiatives, they've generally been top down and they've been about putting the top people in the room to talk about things. And very often you cannot, after all of that conversation, you cannot answer the question which say, I'm a social worker, I'm a practice nurse, I'm a respiratory physician, I'm a GP. What will be different on Monday when I go to work? After all of this conversation, how will this actually affect my practice? And all of the evidence from integration is that the real focus comes from the real benefits comes from the integration of the frontline professionals, their alignment and getting them to work together. So while this is important, don't get me wrong, good governance is important. You do need to get the payment mechanisms right. You do need structures that work. There's not been enough focus on getting people together or on supporting them with some of the basic processes like a shared record that everyone can look at and can look at in a way that is actually helpful. Rather than just a mass of information that doesn't make... we're still struggling with information governance exchange in quite a few areas in a way that is kind of extraordinary, given how long we've been talking about it. People have got individual roles and they're very attached to them, and they have a particular attitude to how they do them and how they manage risk. And again, not enough focus on this. And in particular, we've gone down, particularly in hospitals, but I think more generally, too many specialists, not enough generalists. So we talk about everyone always has to work at the top of their license, which very often ends up with fragmenting jobs into lots of different tasks with handovers, coordination costs, and a risk that no one actually sees the whole picture. I think there's a really interesting growing evidence base actually working to the breadth of your license and making that as wide as possible rather than having everyone trying to work at the top of their license is probably the way to go. So you don't have to have multiple visits from different people, multiple assessments from different professionals, often asking very many of the same questions. So I think a redesign of roles to allow people to be more generalist, but not to underestimate just how difficult it is to get people to step out of their professional boxes, to think about risk in different ways. Sort of classic story is of a geriatrician or an acute physician going on a set of home visits with a GP, and at the end of it saying to the GP, well, I'd have admitted every single one of those patients. Right? So there's just a complete misalignment of the way that people think about risk. So some really tricky job design things, and we've made some very big mistakes with reducing things into tasks. And I'm not convinced. And then having a few people working at the top of their license, supervising all of those task doers, huge cognitive load, loss of continuity for the end user, and actually often in those integrated models, the people experiencing the services record that they're less integrated than they were before. So that's a bit of an own goal. So really this point about getting the professionals to work together, aligning their goals, how they manage risk, and in particular, I think how you get GPs involved. They've often not been enough. They're there, but they're not really been drawn into these models in ways. They are so crucial as part of this system. What this all tells you is that, as I said at the beginning, relationships are a key part of the success of this, and that limits the size of the operating units to this idea that there's a certain number of people with whom you can sustain profitable professional relationships, or indeed any types of relationships, sometimes called the Dunbar number. It's based on some neuroscience which may or may not be right, but it says generally about, advanced primates like us can manage about 100 to 150 connections, right? Which then, if you start scaling up, gives you this number of 30 to 50,000 population for some of these neighbourhood teams, which does seem to crop up in a lot of places, other places in the world. All of that means that this takes time. And if there's one lesson we've learned, is that the NHS and particularly the politicians responsible for it are fantastically impatient, and there's a significant danger that all of the work you do is unravelled with a new initiative because people have lost patience. This all takes time. It takes time to show results. Prevention takes time to show results, and you need to hold the faith. Thank you very much.
Well, good morning. Oh, my goodness me, you did have a late night, didn't you? There are, for me, two strategic inevitabilities in health and social care. The first is that irrespective of government and the flavour of the government, I underline that, I've worked with 13 Secretaries of State, irrespective of government, the growth in GDP will not keep pace with the growth in the cost and demand of health and social care. We have the economic equivalent in health and social care of a COVID crisis. We just don't recognise it. And that requires the same degree of intent, empowerment, and can-do mentality that we had then. The second is that the AI-empowered patient will completely upend healthcare delivery, and sooner than we think, with or without the NHS. That rising demand is principally, as Danny was outlining, more and more people with more and more complex problems. Not just frailty, but people of working age with multiple conditions, people of working age who feel they can't work, kids who come from dysfunctional families, folk with enduring significant mental illness. And they're further disadvantaged by the siloed and fragmented way in which we manage people, seen as parts, not whole. And they go from person to person, organisation to organisation, place to place. And they often end up in the least appropriate place, A&E. It's bad care for them, but it's also not great for the staff, and it's a really bad use of resources. What we know also, and Nigel was alluding to some of this, is that it's by those problems are multifactorial, that the solutions to them lie outside the ability of any single organisation to deal with it. And that if we apply the benefits and experience of all those organisations, the experience and some evidences, and Nigel's right, Alaska is a really stellar example of that. Sounds weird, but it is. Then we can make a difference. But it requires the mobilization of the collective assets in a community, statutory and non-statutory. It means people having agency. The people themselves, maximizing self-management and control, but also empowering organizations to do things that are right for their areas. This is neighborhood health. And it starts by viewing through the lens of the people with these problems, not the lens of organisations, as Nigel said. And that was the starting point for the National Neighbourhood Health Implementation Programme, which some of you may be involved with. We started with that. We did structured interviews with people around the country who'd already been going down this path of more integrated working to learn from them, their knowledge, their experience, to distill that, to share with other people around the country to accelerate implementation. One of the key learnings was that they had all tended to start by the realization they were working on the same problems, often with the same people entirely separately and getting nowhere. And they started to work collectively, and they were making a difference. And it's that knowledge that working collectively, changing behaviors and relationships, yes, altering financial flows, but data sharing, use of estate, permeability of staff between boundaries, these are the ingredients for the recipe for integrated care that works. And that's what we're hoping the sites on the implementation program will do, building on where they are and implementing stuff that's right for them in their places. And this is about empowering people. Those teams involve people from NHS, social care, voluntary sector, and citizens, all collectively around the table working on what they do. Neighbourhood health is more than the NHS. If it's just seen as creating new structures and new organisations, it will fail. If it's seen as simply taking hospital-style care with the same protocols and mechanisms and management in a different geography, it will fail. If it commences through the needs and desires of NHS organisations and looking through that lens, it won't work. If, on the other hand, it's a true partnership, that it is a mobilisation of those collective assets in communities to deal with the complex problems that exist, then it will work. Your voice, your collective voice, whatever the political persuasion of your councils, can make a difference here. My encouragement to you is to use your voice to make sure that this does not slip back to being the NHS-centric, tried, tested and failed model of old, but instead builds on there being a true partnership between people at a local level to do what works there, to impact on that broader strategic inevitability that I talked about at the beginning. The country needs this to work. All your councils need this to work. The people you serve need this to work. So let's all strive together to try and do just that and make it work. Thank you.
Thank you so much. What a fantastic panel. Thank you, all of you. Right, we have some time for questions. We have about 15 minutes for questions. So I think there are some roving mics arriving. I've got two gentlemen at the front down here to start with. So the gentleman in the blue jumper and Tim, just there. Thank you. And if you could stand up and say where you're from, that would be very helpful.
Shall I go first? Okay, so I'm Tim Bidder. I'm Adult Social Care Cabinet Member in Oxfordshire. Given you've identified and the CQC have identified through their inspections there's problems with workforce, what changes do you think the government changes to the overseas workers will have on recruitment in the sector?
And should we take the gentleman in the blue jumper as well, and then you can choose which
John
question you
Holland
want.
from Warwickshire County Council. I'm also a governor of South Warwickshire NHS Hospital Trust. And I think joining things up and being customer-centred is obvious, and that's really what you're saying. And there is a reference in the NHS 10-year plan to neighbourhood plans. Now, where we've gone wrong in the past, we've got 5 NHS trusts, we've got the primary care network, we've got county social services and so on, and they're working from the provider's point of view, but they don't join up from the customer point of view. The JSNAA sort of tried to do this, but hasn't done it because they wrongly defined the areas and didn't define them on the areas of where people live. Now, the 10-year plan refers to neighbourhood plans, and to councils, neighbourhood plans are things that town councils and parish councils have, and they actually do represent the areas where people live and live their lives. So how are we going to get it locally centred down to town and parish council level?
Thank you. If I start with you, Danny, you can choose which bits you'd like to answer, and then we'll work down.
Yeah, I was going to come back on the question about kind of overseas workers. I suppose what we've seen definitely in probably the last, 5 or so, like the success of overseas recruitment has been a real big enabler in a lot of places, and that has really helped. I think probably if we go back, I'll probably get my timelines a bit wrong. We go back 5 years or so, that we were really domiciliary care in particular was kind of the point in the bottleneck that a lot of places were struggling with, hospital discharge, flow through adult social care, and a lot of places in this room have had really successful overseas recruitment campaigns that have really helped to move that forward. And I would say we're seeing that particular issue present less often now. And so to your point, I suppose that does clearly present a significant risk that we rode back on that progress that's been made. I think just the broader recruitment point, and don't have a particular solution to this, and it will interact with the overseas point as well. It's what we see now is particularly therapy, particularly occupational therapy, is kind of if we could have one particular profession to really hone in on as part of this, that it would be that. And again, there will be some interaction there with the overseas point, but that's a much broader question as well.
Thank you.
Can I ask you, the global situation is that there is a shortage of care and health workers. So, I mean, and also there's a political issue around the acceptability of immigration, and not to mention the infrastructure issues. If you have very large amounts of immigration, you don't invest in public infrastructure. I mean, how sustainable is that as a strategy? And don't we need to be thinking about some alternatives more creatively than we do at the moment?
Making better use of the whole system's resources, totally.
Shall I take neighbourhood? Do you want to do neighbourhood?
I was going to have a go with that, deal with the Warwickshire thing. And I think the issue, you're absolutely correct in your judgment and assessment, that unless this actually gets down to frontline teams at a recognisable level, and that will be different in both rural and urban areas, then let me flip it. That is where it will work. That's how it works. That's how you bring people together. And the real problem that has led to what you have described can be summed up in 4 letters, NHSE. They have 17,000 people working centrally. I know of no organisation in any industry globally that thinks having 17,000 people working centrally is either effective or efficient. What it means is there are too many people thinking they have an interest in something when in reality it's a job creation scheme. And that you're starting to see the culture that is both NHS-centric and acute-centric starting to play out again in the agenda. I share with Nigel his anxiety about some of the latest planning guidance, which seems to be shifting. That is why I'm saying to you guys, and I'm disappointed that more of your colleagues aren't here to hear it, because frankly, they're going to have the economic consequences of all this. That your voice to say, no, we're not going down the old route, we need this to work differently, is going to be really important. And that includes making sure that the plans that are developed, you're in on the ground floor and you're creating them. At the risk of I would say this, wouldn't I, to coin Danny from last night's talk, the implementation program is built ground up, and involving people in shaping what happens locally. That's how you get this stuff done. We here won't have the answers. The power lies with you guys to create those answers.
I'm feeling extremely tempted to ask a question of my own, which I might do, but let's see if there are other hands. So there's a gentleman down here and a lady in pink over there, and so we'll take those two, and I'll resist my temptation.
Sorry? Yeah, right, Martin Hill from Lincolnshire. I've been around quite a long time, and probably 15 years ago, what we need is neighbourhood teams, joint working based around the individual, not the... I've heard all this so many times, and the question I'm going to ask is, why hasn't it been done a long time ago? Because I keep hearing it, I keep hearing the talk, and actually it's not happened. So I'll be interested with the panel, why hasn't it happened? Because it's a no-brainer, isn't it? But it hasn't happened. And we're still in the same place we were 15 years ago. And you think, it's not that everybody disagrees, everybody agrees, but why haven't councils and the NHS managed to deliver it? And it's a big mystery to me, because it would save money and be better for everybody. So why hasn't it happened?
I am going to ask my question. I think it's okay.
Amanda Jupp, lead member for Adult Services, West Sussex County Council. In Danny's presentation, apart from AI, you didn't really mention digital, and you also didn't mention getting information out to older people, the older cohort, getting people to prepare for older age, and I think that's really important. We struggle. I mean, we have a very high population of adults 65 plus a high population of adults, working age adults with disabilities, learning disabilities. We need to get people to think about what they're going to do when they get to the age where they might need care. A lot of the time, people turning up at A&E are in crisis. What are we going to do about that? How do we make it easier for people to understand the system? Thank you.
So I'm going to ask my question because I think it's relevant to the first question, which is, if we have a system where hospital care is free and emergency care is free, but social care is not free, are we ever going to manage to persuade people to move to social care before they get to crisis? So I don't know, John, you can start with that.
You're looking at me, aren't you? Yeah, I could tell that. I thought I'd leave it, see if anybody else picks it up. But, both of you are completely right, of course, to answer your question, and I can only give you a personal view, and I speak as someone who's looked at this for 20 years, that I visited places, not just in this country, where it has worked. And there are two answers for me. The first is the bigger one, which is culture. The culture, principally, I would have to say, in the NHS, has not been one that's viewed that it needs to embrace people in community. And some of that is because the leadership of the NHS has historically come from people who've run hospitals, and there's nothing wrong in that, but it also means that under pressure, people tend to go back to what they know, what they don't know. And I think that's some of it. And that's not a criticism of people, but it's just trying to understand how their thinking has worked. The issue around is this just because social care is means tested and NHS isn't? No, I don't think it is. I think it's more fundamental around the culture and behaviour, because people can get around that. They can get around that and have done. And where we do see where it works, where people have been creative. I remember, I'm not actually going to say where it was, but it was somewhere in the southwest. And I went, this was now probably 12, 15 years ago. And this was a council and the health organisations who really had to come together. And they'd come up with some creative solutions. And I was listening to presentations. And some were from people from the council, some were people from the NHS. I could not have told you who was from where. And the finance guys had come up with some really clever way of doing it. And they were saying to me, and we were wondering whether to present this up in London. They said, whatever you do, for God's sake, just keep it to yourselves, you know, and get on with it. It's a sort of, you know, ask for forgiveness, not permission sort of thing. But the key to this is actually changing relationships and behaviours. And sometimes that is about, you know, so the lead stuff started off because Julian Hartley was there, Tom Reardon was there. I could name a number of others. It's starting, but you have to make the first move. I presented to the Shelford Group, which is, those of you who don't know, is like the big beasts in the acute trust world around the country, all their chief execs. And I said to you, how many of you have actually gone out and spent a day in general practice or with a home care worker? And if you haven't, maybe you should. And is that, I have long believed, and the reason we keep going around the hamster wheel, is why do we train managers for the NHS separate from managers for local authority? Why don't we actually, in the training programs, have joint training? Because once you start to get people to trust and understand each other's roles, you start to build the behaviours and relationships which enables you to overcome some of the more logistical boundaries. I know it's a very long answer, and I do apologise. But very briefly, if I could say about the digital thing. I went to Denmark in November 23 to see what they've been doing. There, a group of people had multiple long-term conditions with rising risk, which, as Nigel says, that's why the implementation program has been is focused on that particular group. It's where you get the biggest bang for your buck. So these are people with, you know, long-term chest disease, heart disease, diabetes. Those of you who are non-medical, there's a cluster of stuff which is frequent. And they inputted their own data on weight, blood pressure, blood sugar, etc. into an app. It whizzed off. They actually had an AI thing, interpret it. Clinicians checked it, went back. In the 2 years iteration, folk had begun to learn about their own conditions, began to understand and expect the response. And these were not, you know, degree level educated. This was ordinary folk. Result, 30-odd% reduction in unscheduled admissions to hospital, 50% reduction in utilisation of any health and social care. That's entirely reproducible if we had the will and the energy to do so. And it goes back to the most underused resource in our health and care system are the people who use it.
Thank you. Fantastic. Nigel.
I better be quick. Not enough focus on actually doing this and an awful lot of talking about it. I think the cultural problems that John mentioned, I mean, it is worth saying that the NHS itself is not particularly integrated. So, you know, expecting them to be able to integrate with something else when it can't even manage it internally is perhaps a big ask. So, and the same problem exists there, which is hospitals are very culturally different from community services, mental health services and general practice. And we've not had enough focus on actually just spending the time to get people to work together. And to be fair, this is a problem across Europe. You know, services are not integrated in most parts of Europe. And people struggle with this, and it's really hard. So that's probably the answer. I think this is much more difficult than people think. But the other problem, I think, is we've not had nearly enough focus on, you know, really pushing things down to the frontline teams and getting them to work on it. And so, particularly in the NHS, we are stuck with an extremely reactive model. That people used to joke about hospitals that. People run hospitals think next week is strategic and the week after is the unimaginable future. That mindset is very much embedded in the NHS at the moment.
Just to come back, I think I totally agree with the point you made. I think we've done this study before where you go into a hospital ward and you ask older people, where do you want to go after you stay in hospital? You know, 3/4 of the time the person themselves will say home. 3/4 of the time the medic will say a residential bed, and about somewhere in the middle, the family will say, 50% of the time, maybe the family will say a residential bed. So to that point on involving people more, I think that's really clear. And I think what we're starting to find now is as we reach out to people to talk about potential risks that have been identified, that's really hard, bringing people into that conversation. And perhaps it's to what Nigel was saying earlier about changing it back from a conversation about risk to healthy life expectancy and living well. So I definitely think there's something to tap into there, the point you've made.
Fantastic. I'm afraid we haven't got time for any more questions, but I think it's been a really interesting discussion. Thank you all for being here, and thank you so much to our panel, who have been wonderful. Thank you.
And also, I guess that's what the whole machinery is so obsessed with, the emission.
We've got a countdown clock this time. Right. Well, that clock light's bright, isn't it?
Oh, yes.
Okay. Good morning, everybody. We'll have a quick start for this one. We don't want to run out of time at the end. So welcome to Counties at the Core, driving infrastructure, renewal and delivery. You'll notice the way we hid the fact that it's about highways. We don't want to pack the hole. It's been a great conference, hasn't it? Yep. And we've had some really important sessions about SEND, children's social care, fair funding, and all the other things. All those things that can bust a council's budget. But when you go on the doorstep, what do people talk about? Potholes, yeah. So I'm very pleased that this morning we've got this session, which is focused on maintaining our highways and the highways of national highways. So we're joined by two organisations right at the heart of this agenda. National Highways, they look after our strategic road network. I think we all have a relationship. Does every county have a national highway in it? There's a question. Yeah, I didn't think about that one. We couldn't think earlier on of anyone that didn't, except possibly Rutland, but we weren't sure. So we've all got a relationship with National Highways. We've also got the Chartered Institute of Highways and Transportation, who are champions of professional excellence across the sector. So they bring national insight, practical experience, and a really clear view of how we can strengthen collaboration to renew and future-proof our infrastructure. So our session is going to explore how, as counties, we can take a more coordinated and innovative role in managing our ageing assets that we all know too well, improving the resilience and delivering the road network our economies rely on. So thanks for coming this morning. Let's get started. Adam, over to you. Yep.
Good morning, everyone. Adam Simmons here from National Highways. I'm Director for Strategic Planning. I wanted to use a bit of time just to talk to you a little bit about what we're thinking about. I think how we're already working with counties, with mayoral strategic authorities, subnational transport bodies. But I was reflecting actually this morning as I came in perhaps a little bit close to the wire for a 10 o'clock start, but just how much people use and rely on the road network and actually think of it as a single road network. I know sometimes we can think that strictly there is the strategic road network that National Highways is responsible, strictly there are the roads that the local highway authority is responsible for. But as I was about to leave and my wife said, could you actually just drop our daughter off first? Having that flexibility to drive to her school, come back here, using Waze to get there. Even I was not thinking, I'm on my own network here, or I'm on a different network here. It was a flexible and seamless journey to get through. And yes, I did hit some traffic. I'll talk perhaps a little bit about that as we go through. But it really sort of struck me, just how reliant we are. And I do a lot of work with the Department for Transport, of course. But I used to work for the Department for Transport. It's very easy, perhaps, to have that London-centric bubble and perspective. But if I think about some research that Transport for the North did, I think it was something like 97% of trips are happening on the road. So clearly a critical asset across local and strategic roads. So as National Highways, we're responsible for England's motorways, with a couple of minor exceptions, and major A roads. It's of all the road network, it represents 4,500 miles, so that's only 2%, I think, of the total mileage of the road network. But we carry a third of all traffic and 2/3 of all freight. And I think actually in particular for me, particularly with the agenda of central government and I think kind of local governments, obviously economic growth is incredibly important. I think the movement of goods and logistics is a very important customer for all of us to have in mind. Some research that we did a couple of years ago shows that of 4 sectors that are reliant on the strategic road networks, kind of logistics, manufacturing, construction and materials, they contribute over £400 billion in gross value added to the economy. I think so, it was about a quarter of the economy. So as National Highways, we were set up from Highways Agency. We were first Highways England back in 2015. And actually that marked the time where, yes, we were set up as a government company, so a slightly different governance around us, but I think very helpfully for us and critically, and perhaps something that Sue might sort of talk about for local roads as well, we had 5-year funding settlements brought in at that point. Up to that stage, we had annual settlements and annual plans. And certainly for us, I think that roads reform, those 5-year settlements have been very, very helpful in terms of us planning the work that needs to be done. And certainly giving our suppliers, giving our customers more certainty about plans going forward. And we're about to come into our third road investment strategy, our third road period next year. That will run from next year up to 2031. I think it's fair to say over the course of those sort of 10, 11 years, perhaps some of the priorities and focus has changed. When National Highways was first set up, there was a lot of focus on brand new investments, widening schemes, adding new capacity to the network. as we have gone through, and we've made the case in the current road period that we're in, and we've made the case to government again for the next road investment strategy, increasingly the priority is the existing and ageing asset. A lot of our roads are built in the 60s and 70s, and we're starting to see those get to the point of life expiry and requiring a lot more significant renewals work. I think that raises a number of challenges. First, I think sometimes making the case for renewals is not as easy as making the case for like a new scheme. You know, you can have a ribbon-cutting ceremony. But also just how we build those business cases for that is difficult. But really here, what we're saying is what we don't want is our roads to be a drag on economic growth. We don't want those weight restrictions for trucks. We don't want speed restrictions. We don't want diversions and so on, emergency works to be put in. In the long run, that makes it a lot more expensive as well. So as we look ahead, we've really been saying that probably our renewal of pavement, road surfacing, is continuing at the same rate. We're largely tackling sort of flexible asphalt pavement as we go through. We're going through a program of replacing the concrete road surfacing that we have. But I think increasingly we are going to see a need for much more investment in large structures on our network. I think if we have the example of the Clifton Bridge coming into Nottingham a few years ago, that was something where an inspection revealed that had to be closed immediately. I think TomTom data then showed Nottingham was the most congested city, I don't know if it was in the world, certainly Europe, an unenviable statistic to have. And actually I'm very conscious that the work that we were doing not only affected our bit of the road, but the local road that was passing underneath. So, you know, very much the local and strategic network intimately related there, having that impact. So we want to be ahead of that game. We want to think about the works that we need to do. And I think as Councillor Thornton well knows, there's some pretty major works that are being planned at the moment. So along Loon Gorge, I think there's something like 6 bridges that need doing along there. The bridge across one of the bridges across into Wales, the M48 sort of 7 crossing there. There are weight restrictions on there at the moment, and we really want to be looking ahead. And actually what I reflect in this, and one of the direct areas of responsibility that I have, is that having a 5-year investment is incredibly helpful, and I think that's been a massive step forward in how we think about our assets and how we think about investing in the strategic road network. But actually we want to look even further ahead than that. And for me, the conversations I want to have with government in particular is perhaps not to have investment over 10 or 15 years, but at least to talk about these are the challenges that are coming up over those periods. And actually we're already having good conversations, I think, with probably a number of you in the room or your colleagues back at the ranch about some of these structures that we know are going to need work in the future road periods beyond. And let's really think about what that profile looks like so we don't suddenly get hit with almost a backlog of too much to do, which either we can't afford to do, or if we do all that work, that's going to put a lot of roadworks on the system. I would say as well for us, we're very conscious that, as we've seen with the recent storms and the flooding in South Wales, obviously climate resilience is a big thing. For us, how we think about renewals of our drainage asset is going to be a big challenge. If we look at our current standard, which does for drainage, which does take into account climate resilience and perhaps has the capacity for the sort of volume of water on there, I think something like certainly over 90% of our drainage does not currently conform to that because it was built before that standard came in. So how do we think not only about that renewals work, but how do we almost work through that backlog and meet a changing need of our asset? And I'm sure that's something that is a common thing with yours. I just wanted to touch on before I wrap up, and then very happy to take questions in the panel. There are obviously a few things where I think we have some common interest, and I think absolutely where we want to do more to work in genuine sort of partnership. First, I'm very conscious that when we can do work, that can lead to diversions onto local networks. I think we need to be honest about that. I think more is done to think about how we think about diversion routes there. One opportunity I think we have is recently we now put our details of our diversion routes. We now have a contract and a relationship with wayfinders like Google Maps, with Waze. So the diversions that are on your app on your phone or in your car are now, if you like, the genuine ones. I think in the past, I think certainly when we closed the M25 the first time, we had to put a lot of communications out to say, don't listen to your sat-nav, follow the yellow signs. It was reasonably successful, but actually since then we've are now able to put those data out, if you like, the official diversion routes. And actually I think there's a genuine opportunity which we are exploring with the Department for Transport, and I think shortly with ADEPT. We're conscious that having that relationship perhaps from 150 local highway authorities with Google and Waze, it's a lot of contracts to set up. We already have that relationship there. Can we act as a broker on your behalf? And I think that's a conversation that we're really keen to have, and I think could be a great opportunity there about that's just how people consume information about their journeys, and I think that's an opportunity. I think the other area I'd say is, as we are looking ahead to our future plans, I want to do a lot more to genuinely fully understand the plans that are coming from, whether it's sort of county councils, mayoral strategic authorities, or what have you. For the last road investment strategy, we have to complete something called route strategies. We did a lot of work, particularly through subnational transport bodies, to really understand those plans, perhaps those housing plans. I think I really want to sort of step that up a bit further, and almost I think where are those real sort of pinch points, where are those real things where investment in the strategic road network can help unlock growth and benefits locally, and I think how can that help improve our case to government for why we might invest in certain areas. And one opportunity there, as we come into the next road period, yes, there will be some of the bigger widening investments, but we all know that there's a financial challenge across the whole part of public sector spending. We're saying to government, well, there are probably some smaller investments that we can do. Investments in things like junction improvements, or even safety, smaller safety improvements. Actually, these are often the bottlenecks for local journeys, and I think often that interface with strategic and local roads. So we've made the case to have that targeted investment there, and I think my gut feel is that's something that can grow in those sort of targeted funds. But if we get together and genuinely sort of work collaboratively on how we solve, particularly around urban centres, urban areas, not just what the strategic road network investment is, and then separately what the local highway investment is or what have you, but much more of a collective business case. I think there's a big opportunity there, and we'd be delighted to explore that a little bit further. Councillor Thornton, I think that's sort of for my introduction, and then I'll hand over to you and to Sue.
Thanks very much, Adam. I can see the questions being written down out there. But first we've got Sue. And Sue, I think you're going to cover it more from the local road network angle, aren't you? And Sue actually started her career in local government, I believe. So she's one of us.
Thank you very much. And I've got a few slides just to elaborate a little bit more on what I'm going to be saying. But anyway, good morning, everyone. Thank you very much for inviting me here today, and it's a real pleasure to be here. And I'm Sue Percy, and I'm the Chief Executive of the Institution of Highways and Transportation, which is really what it says on the tin. So we are a chartered body, and we have professionals that work in highways and transportation. Your councils probably employ a lot of our members. We also have local councillors as well, and we work a lot with national highways. So we tend to represent across the whole of the highways and transport sector. Now, it's not just about individual professionals. We have also a lot of the supply chain that Adam was just referring to, as well as academia, research bodies, and the public sector. So we, I think, feel that we can talk on behalf of highways and transportation because of the voices that we represent. And we set qualifications, we set professional standards, because it's so important that we have public trust in the way that we deal with infrastructure, and we deliver insights and industry updates and so on. So our purpose, therefore, is to advance the science and art of highways and transportation. And I think it's really important that there's two words there, art and science. So it's not just about an engineering solution. It is about the customer, the people that use our networks as well, and how they interact with our networks. Because local highways are absolutely critical. They are an enabler, and certainly when I talk to politicians from across the board at national, local level, the conversation has changed from talking about a road to actually about what the highway can do. Adam touched very briefly on the fact that, you can release land, you can regenerate areas. So it's really about connecting, it's about economic growth, and it's about really being able to deliver on some of the big public policy agendas that we all have to tackle. So local roads are not just about the movement of traffic. They are also about the movement of people as well as goods, about community spaces, about active travel, and also, of course, our network hosts utilities, and now we're dealing with EV infrastructure as well. So our roads, our local highways are really important for economic growth and for achieving net zero, for air quality, and also for helping to support a more active lifestyle. So local roads really tick so many boxes beyond just moving you and I around from A to B. And I think this is really, really important, because I think local roads maybe don't get as much attention or as much funding as they should do, given the things that local roads deliver on behalf of local authorities and for the public and for the economy. I just wanted to give sort of one example of what I mean by that, and this is around active travel and how important our local network is to that. So if you look at the return on investment, which we all have to focus on nowadays, if you're investing in active travel, so that's sort of investing in walking and wheeling and cycling, you get a return of investment of about £5.62 for every pound you invest. And that equates to also around £780 million saved in mental health services, as well as about £540 million of savings for just local GP visits. And that's massive, and that's just a small snapshot of what the local highway network can deliver. And certainly, if you look at just transport emissions, if you're looking at active travel, you have a saving of around about 10% on transport emissions, and up to over 8,300 premature deaths, and again a saving of £567 million through better air quality. And these are not insignificant numbers. So the bottom line, for me at least, when we're talking about the local highways network, is that it is a really key enabler for connecting people and goods, but also some of these much wider agendas where we do need to start seeing how we can enable a different sort of relationship with health, for example. So for the local highways authorities, you're central to delivering these objectives, and you have certain duties. You have a duty for the network, you have a duty of coordinating works on your network, and for managing traffic. And you've got the various acts and legislation on the slide there. So you do have a duty there as well. And that's really important, because you're doing all these things despite resource constraints. You're actually innovating, you're delivering on these despite a very resource-constrained environment. And that's one of the things that we talk an awful lot to local government, but also to national government about why local roads are so important. Just to give you a flavour of some of the things as an institution that we have been focusing on in the last 12 months. So you can see from the slide, we've been talking about last mile delivery. That's often the bit that really gets neglected. It's also about how we unlock the benefits of long-term funding for local roads, and I'll come back to that. Reducing the impact of local highways works on road users, because I'm sure many of you will get a lot of correspondence about that, and overcoming the barriers to active travel schemes. So, some of the key challenges there, I just want to touch on these very, very briefly. So, some of the big issues, it's not comprehensive, but I'm just going to pull out 4. One of them is about funding, one is about managing disruption, scaling EV infrastructure and addressing ageing assets. And again, there will be crossover, obviously, with Adam and the strategic network. So let's just talk about funding. Now, funding for me and for the institution is the number one challenge. Because for the local network, unlike the strategic network, we still have very short-term, fragmented funding pots, making long-term planning really challenging. So if you think, when I first came to CIHT, someone tried to describe how local highways are funded. And it's one of the most complicated descriptions I've ever heard. And it continues, because you get funding pots from all over the place, from Department of Transport, from housing and local communities. You have bids that you can fund into. And if anyone understands local highways funding, please do let me know, and I'll have a chat with you afterwards. And yet the strategic network has a 5-year pipeline, know what's coming down the line, and we're not talking about something insignificant, we're talking about a major national asset that has a funding line that doesn't match the importance of the asset. So we've been arguing for quite a while now that actually if you look and give more certainty of funding, you can actually get some really significant efficiency savings of between £1 and £2.2 billion. And you can imagine what you could do with that sort of saving, whether you reinvest it into your highway network or into other areas. So this is a real critical opportunity, and it's something that we are pressing government on very, very heavily at the moment, and talking to ministers about this. The next challenge, I think, is also managing disruption, because roadworks are essential, we all know that, but disruption is a major issue, and I'm sure we all get very frustrated when we get stuck in traffic jams because utility companies and others are digging up the roads again. So we've done a piece of work around how do you actually get that much more coordinated, how do we increase collaboration at the local area, and that's really important between the promoters of roadworks, the authorities, and the contractors. And I think there are ways that we can unpick that and make that much more smooth, using technology, doing things jointly, data sharing, and using AI as a way of monitoring and real-time dashboards. So it's not beyond us to actually minimise disruption around road works. Electric vehicles. We know they're coming, they're here, and they're going to get more important. And from the research that we have, the UK needs 300,000 public charge points by 2030. At the moment, we have 82,000. You don't have to be good at maths to understand there's a bit of a gap there. But for us, local authorities play a really important role, because you can be an enabler, you can stimulate early adoption, You can help to attract private investment into EV charging, and you can also make sure around accessibility issues, some of those challenges as well. So leadership in this area is critical for reliable, widespread network of EV infrastructure. Ageing infrastructure. Adam's just talked a little bit about this. I'm not going to focus just at the moment just on potholes, because I'm sure that's something that is very familiar to you all. It is really important. It's what we all notice on our highways. But I was also going to mention about bridges. So we've got 3,000 bridges that can't support heavy vehicles now, and we will be facing collapses. I mean, I don't want to scaremonger, but that is the state of some of our assets, our bridge assets. It is really, really critical. And because of more flooding, because of more storms, more wind, more heat, that variation in the climate, it is going to accelerate failures. You will see that because of the amount of potholes that you get, but you've also got to think about your structures as well. And we do welcome the government's £1 billion structures fund, but we've got to really think differently and be much more proactive around maintenance and resilience planning on essential infrastructure structures. So, one of the things that we can do and work together is around building capability and strengthening the relationships, because a lot of these things need that collaboration. They need strategic collaboration and the right skills in the right place. And one of the worries for me, at least, is how we attract new talent with the right skills into our sector, into the public sector, so that we can deal with these challenges efficiently and effectively. We've got some very, very good people here already, but actually we need to make sure that we've got that future-proof talent and capability as we go forward as well. And certainly we are doing our bit through providing a digital learning platform and bespoke courses and training for practitioners, and we will continue to do that. And just as I'm sort of wrapping up, I just wanted to highlight our bus centre of excellence, because this is also an important area of how you actually support the local population moving around. And this is funded by DFT and managed by CIHT. Some of you might be grappling with franchising, for example. But again, this is about how we also support and build capability and share best practice in the bus sector. So, key takeaways for me: local roads, the local network is vital. It's vital for growth, economic growth. It's vital for the housing agenda, and it's vital for the health agenda, as well as the air pollution and net zero agenda as well. Authorities face big challenges, be that funding, disruption, EV rollout, ageing infrastructure. But actually, I think there are some really encouraging signs, but we've really got to press ahead and keep pressing the case for the importance of investing in the resilience and adaptation of the local network. And certainly CIHT will keep pressing the case as well on these issues. And so if you are interested and want to know more about what we do, there's a QR code here that you can scan, or please come and have a chat with me afterwards. Thank you very much.
Thanks very much, Sue. I saw an awful lot of nodding in the audience there, and a lot of subjects you touched on are absolutely, key to our hearts, I think. So we've got a few questions there. We've got one over here from, is it Richard to start with? Oh, can you all, if you all stand up so we can see you, and then give your name and title and where you're from, that would be great.
Councillor Richard Wilkins from Somerset Council, Transport and Waste Services. First of all, thank you very much for the presentation. I look forward to getting a copy of the slides, in particular on the active travel benefits, which I think will be very useful. And it does lead to a question on revenue and maintenance of those routes that we don't get, that we should get as an equivalent to a normal road. But I did have a couple of parochial questions, which I'm not going to ask now. But one question for Adam. You talked about Google Maps, but when is National Highways going to do every street works coordinator a favour and embrace one network?
Adam, question for you.
I mean, so I don't have a sort of a date answer for that. I know from talking to our digital team that is something where they're having conversations about that. Not my area of expertise, but I know with these things, there's a lot about getting that right of getting the right sort of information, the right kind of contract's not the right word, but getting the right sort of arrangements together. So I'm sorry not to be able to sort of say kind of timings around that. I know it is something that is being worked on, but actually, genuinely good to hear that is a point coming up in the first question, because that's something I can just kind of take back as well. But thank you, and sorry for not being able to give a more definitive answer.
Could I just follow in that, because we've just done a report on street works and road works, and one of the things that we've been pushing for is that piece around coordination. And we've been proposing, we have a sort of street works commissioner that actually starts to really bring these things together, whether it's from the data side, whether it's from the actual just the organisation side, because there's a lot of people involved. And the key thing for us, at least, is that you don't want to dig up the road and then 6 months later dig it up again. That's the most thing that infuriates people. So we've been doing a report which says how actually can you coordinate this differently, both using the data, but actually having a system where you put that information in and then people can understand that and use that so that you don't have another street works 6 months later.
In my area, street works is actually bigger than potholes. Do you all use one network? If you don't, then make sure you look it up. It's a fantastic tool. Now, we've got a question at the back, and then we've got one at the front. So we'll take the one at the back first.
Thank you. Keith Glazier, leader of East Sussex County Council, but also chairman of Transport for the South East. Thank you for your presentation this morning. And I have to say, I've learned something because I've not heard of the Institute in the 8 years that I've been leading a subnational transport board. So something's going wrong in the communications, and I'll have a conversation afterwards. And I thank the National Highways for sitting on our board and actually having those conversations with the 16 transport authorities that make up our subnational transport board. My real point is that the connection between all of these and all of the other transport issues that exist are, I don't say under threat. The government have given us notice that the monies for funding subnational transport bodies will change in 2027. But actually having local authorities working together and have all of the platforms that you spoke about that exist on the local areas is essential. I'm very pleased that the Secretary of State, Heidi Alexandra, was instrumental in setting up our board. She was on Transport for London then, and she understands it. So I should be in there very shortly telling her that she's made a mistake on funding by 1 year, because when the mayors come in 27, 28, they will automatically be able to sit on a subnational transport body and form all of their strategies across a wider geography than what mayors will do. And if you take what Andy Burnham said about Transport for the North, if it didn't exist, he would have had to create it. So it's a thank you for enlightening me this morning, all of you, but don't forget that in local government, we have this here already that is at risk.
Thanks, Peter. I didn't quite notice the question there, but do you have any?
I mean, I would just sort of echo really what's been said, and I know when we're working with the Department for Transport, we just agreed the second road investment strategy, so what has covered the last 5 years, and as we tend to plan these things in the 5-year cycle, so you go straight into planning the next one. But we were directed very closely to work with subnational transport bodies. One of the roads, Baron Sphere, I think, was the roads minister at the time. We did a sort of whole sort of engagement across their subnational transport bodies. And I think kind of what you really put your finger on there is I fully get that there's quite a range of local authorities that will have an interest in a particular local area. And STBs were very, very helpful in helping to convene and coordinate that. So we'll do need to continue to have that side of things. And I think I absolutely recognise a challenge for us is I think just getting even deeper into the understanding of those sorts of issues and what each authority is trying to achieve and how we as National Highways or obviously whomever else is involved can really contribute to that. So I think we're really hearing obviously from government economic growth across the whole country, but certainly with, I think, the local devolution agenda as it's going through, how we unlock those opportunities. And for me, I really want to understand not only how we are maintaining, I guess, parts of our network that are important already, but almost which bits almost have the most potential as well. And I'm really keen to try and understand that. So I think you've really, I mean, the STBs, thank you, you've done a brilliant job and continue to do a brilliant job, but you've really put your finger on the point there that convening those interests across quite a, sometimes a big group, you mentioned 16 for Transport for the South East, is a really important thing.
Sue?
Yeah, I was just going to echo that because it's around scale. Years ago when we had a much more regional focus, that disappeared, and whether we were in the planning world or the transport world, that really caused problems. And then the STBs came along and actually helped to provide that overview and seeing those connections, looking at it from the local level between that and strategic network. And I think that's really, really critical for a really well-connected, appropriate transport network. Given that it also locks into things like the energy agenda as well. And I think that with the loss of the STBs, I think there's going to be quite a gap there. So certainly the message that we're going back to government with is to really understand, how that might be plugged if they do carry on. So I think, more power to your elbow, actually.
Mm. We're running out of time here, but we've got time for one more question, I think, at the front from the lady here.
Thank you. I'm Kay Mason-Billig. I'm the leader of Norfolk County Council, #1 for fixing potholes, second year running, just saying. And we have over 6,000 miles of road. We know that 75% of the roadworks are down to utilities or national highways. But the Highways Authority have very little control over that. And I believe there was a select committee which recommended to government that we should have more control about saying when they happen and where. But that was rejected by the government. Do you believe that Highways Authority should have more control over those things? And secondly, for Adam, we have 3 major infrastructure schemes going on at the same time in Norfolk. 2 were delayed due to an environmental activist. So it's the perfect storm now. As a county council, we get all the flack for that, but there's nobody that local people can write to ask the usual stupid questions like, why don't you do it at night? Why don't you do it as fast as China? Things like that. Can I give them your email address, please, Adam?
So, Adam, why can't we do it as fast as China? If I had £1 for every time I've been asked that, I'd be a rich man.
I think you're right to raise it. I mean, and we do share wanting to do better. And I think in different schemes have done that sort of engagement sort of better. I think the A14 scheme, which a few years ago now, I think did very well with its engagement. I think I kind of share some of understand the frustration of how big infrastructure investment can be delayed as well. I think actually as we go ahead now, we have actually got through a lot of the planning challenge stages. I think as we look to the next 5 years, they're in the doing. But each project will have its sort of local sort of teams to engage. Can we do better? Of course. But I think that there absolutely is the will to do that. I don't know if they'll get much money out of emailing me, but there are absolutely contacts to National Highways, and in specific cases, obviously, be delighted to make sure we've got the right teams talking to you.
Thanks, Adam. Sue, do you want to cover the street works?
Of course I will. It's really interesting the point you raised, because you're quite right. The Transport Committee came up with a set of recommendations, and government has accepted some, but not all of them. We've done our own independent piece of work, and actually our recommendations are very close to the Transport Committee. So it's two different organisations or bodies now saying these things are important. So we're going to go back to government and saying, can we relook at this? Can we have a look at this again? Because these things are really important. They will help with street works, and street works aren't going to go away. With all the things that are going on at the moment, the pressure on the space is going to get even more, and so we've got to find a solution to this. So we will be talking to government again and picking up on both what the Transport Committee said through Ruth Cadbury's committee, as well as what we've been asking for as well.
Thank you, Sue. Thank you, Adam. I think that's been a really good session. Note to CCN, next time we need a whole hour for this one. Highways is so important to us, isn't it, to us all. Can I say to you that this is the start of the refreshment break? Can you get back by 11:15 sharp, please? And I think you two are probably going to hang around for a while, aren't you? Yes. Have a coffee, so there's a chance for chatting afterwards. But thank you very much.
Thank you.
Really good.
Put a virtual background in, couldn't you?
Blur it.
I would at least blur.
Hello. We're chatting away about Robert's background. Can you hear us, Robert?
Oh, just to let you know, we're going to, you'll be on the screen in a minute.
Well, good morning, everybody. Thank you for joining us. Today, this session is going to be about the future of local government, and we're going to hear some differing opinions, perhaps, hopefully, and get some questions. And for me, all these sessions really come to life when we start getting questions. So I will try and give us as much time to talk about things with you as opposed to talk at you, because that's never good, is it? My name's Sean Matthews. I'm leader of Lincolnshire County Council. Have been since May, never before involved with councils. So my first time in the chamber was my acceptance speech, which is a baptism of fire. But on my left is Polly Mackenzie. I'll let her introduce herself in a second. And Dr. Simon Kay is on my right. And if you're expecting a cash porn, then I'm afraid he had a bit of a football injury. He's broken his collarbone, so he's apparently in agony. I think the idea was to get him here on some morphine and see what happened, but we'd better not. And just to prove that Reform are quite happy with people working from home, we have Robert Cavell, who has some childcare issues, so he's joining us down the line. There he is. Hello, Robert.
Hello.
So I hope you've had a good time. There's some really interesting talks that's taken place yesterday. I'll be really pleased when I don't have to have any more alcohol and my liver can start recovering. But the SEND yesterday morning was fabulous. So was local government reorganisation. And both those talks, it's lovely to see and hear that we are saying the same things. When you're isolated in wonderful Lincolnshire and you're saying things, sometimes you may think, is it just me? But it's fantastic to know that these things are being talked about throughout the country and throughout all the councils. So without further ado, let me hand over to Polly. She's going to go to the podium.
Now I feel embarrassed.
No, don't. No, I would have done it as well, but I didn't bring my laptop, so. Over to Polly.
Okay, great. So yeah, I wrote my notes on the train on my computer and then realised that I was going to have to stand up or I'll just drop it. So I'm Polly. I'm actually the CEO of an innovation company called Zinc Innovation Partners that works to help science and innovation change the world, turning research into kind of real-world outcomes. But I used to run a think tank, Demos. I used to work at a university, and I used to work for the government. I worked for Nick Clegg during the coalition years. And, well, I've done lots of things. So what I'm really interested in, even though this is a sort of political panel, is really just the practical questions of how do you run a country. I'm really interested in bureaucracies and how we kind of change and reform bureaucracies. And last time I was here, does anybody remember? It was like 4 years ago. I did a song. I'm not going to do a song because it's not the evening and I'm not drunk. But I want to give you a word that I made up. At least I think I made it up. And the word is iconoclastic. Right, so we all know what iconoclastic means. It's when you want to like smash everything up. And plastic, obviously it means like the stuff that kills turtles, but also in kind of physics terms means like the opposite of elastic, something where when you squeeze it, it stays changed. And it seems to me that in this quite iconoclastic era, the way we need to think about our bureaucracies is with that concept in mind, the idea of getting to the point of being able to do agile, fast reform that sticks, and having, as I said, I just spent 3 years working in a university because I thought it would be really good to learn about how to reform public bureaucracies. And I learned that it's really hard, which you already knew, right? But trying to do kind of change leadership in a place where, so I don't know if this is true among county council staff, but one feature of University of the Arts London where I worked is when we did a people survey, the longer you'd been there, the more unhappy you were, statistically. And it is so baffling to me, who's somebody who's been working for 25 years and perhaps had 15 jobs, is the idea of being unhappy at work and staying there for 25 years. But people do. And of course, if we want to change bureaucracies, we need to kind of engage with those people exactly as they are. So if we want to be iconoclastic, what might that mean? And one of the things I would observe when it comes to change is that, so have you heard of the kind of 3 horizons model, thinking about change, right? There's what are we just trying to do today? How do we get through the day? That's the first horizon. The third horizon is, where do we want to be in 50 years? What's the dream? What's the vision? But most change happens at the second horizon, which is where you're trying to translate surviving day to day into the big steps that might get you towards that kind of visionary future. And I think one of the challenges that we face in leading our bureaucracies is that there are lots of people who exist at that third horizon who are the reformers. And there are lots of people, particularly in senior levels, who are just surviving day to day. And lots of kind of new public management theory and kind of expectations from the center of the state just force you to stick with surviving day to day. And life in the middle is really, really tough. It's tough because trying to deliver change means you're an irritation to the people who are just trying to get through the day. And you're a disappointment to the dreamers. And that second horizon is bloody difficult. And having just tried to implement a net zero plan in a bureaucracy, having pissed literally everybody off because I wanted to change things, but I was not able to just obliterate the boundaries of reality. I was talking to a council leader, not a county council leader recently, who told me that one of the key tips they tell to kind of reformers, the dreamers, is stop wearing flowery shirts. Because when you... that's a tie. Also, it's paisley. Because the problem is when you're engaging with somebody who is a CFO or has bureaucratic responsibilities, sometimes legal responsibilities, is that if you look like you are not engaged with reality, they will not take you seriously. We all have to engage with the reality as it is. And so there's a friend of mine called James Plunkett has set up with the Joseph Rowntree Foundation something called the Centre for the Edge, which is looking at how you get that reformist zeal, that energy from the edges of bureaucracies and public services into the mainstream. And part of that is about changing the centre so it is more adaptive, so it's more iconoclastic, changing lots of the rules that central government imposes on local government. Absolutely. But some of it is also a message for the evangelicals and the purists who are constantly frustrated and disappointed with the boundaries of reality and need, in a way, to be able to join the conversation. One of the lines that Wes Streeting said recently about the NHS is he observed that it has more pilots than the NHS. More pilots than the NHS. It's no pilot. No, the NHS has more pilots than the RAF. Wow. Not actual pilots, obviously. But it's that piloting mentality, right? Is you've got this complicated, stultifying bureaucracy. Like, what if we just sort of ignored that, and over here we made a nice, shiny new thing in a community building? It's obviously much more fun, much more agile, much more original, much more adaptive. But if you haven't planned for how it's going to change things, it's not a pilot. It's just a nice thing, right? You have to think about how you will connect things through the second horizon. And the battery pack on my microphone is pulling my dress down, which is why I'm fidgeting. Sorry about that. So I think that that's absolutely critical, is to think about what does a career look like for people who are operating at the second horizon, who are the most important people in delivering change and who are having a miserable time because the bureaucrats find them irritating and the evangelicals find them disappointing. And if we can make that really work, I feel like we can get to the point of being able to change our public bureaucracies at pace. I had 3 more thoughts. One is that change is a strategy function. I see more and more councils who are bringing change and strategy together. And strategy is one of those functions which has to go across, which forces you to break down silos and collaborations and enable collaborations. And I see the councils that are thinking about change in that way, rather than thinking of it through a whole series of different verticals, are, it seems to me, making more and more progress. And it's cross-cutting infrastructure to enable change. The other thing that I think is a strategy function is procurement. That's a bit more of a weird thing to observe. Most people think that procurement is about buying stuff and controlling the costs. But procurement is about shaping the market for the things that you want to see in your community and in your place. So let me tell you about something really cool called NSIF. Anyone know about NSIF? That's because you don't have responsibility for defense and national security. So NSIF is an amazing innovation that is helping accelerate innovation in defense and national security by de-risking innovation. So the defense and security services have created essentially a problem book. They are able to articulate the gaps in what they can buy, the things they would buy if they existed. And they're able to attach the value at stake to those problems. That problem book is then shared with innovators, experimenters, businesses, researchers, academics, who can think about, how might I solve that seemingly unsolvable problem? And then NSIF is a venture capital fund established by the British Business Bank that can come in at the side because you know there's a purchaser at the end if you can solve the problem. That massively de-risks the innovation process and means that finance can get in to support the cost of R&D to get to a solution. I think this is brilliant in defense and national security, but it astonishes me that we are literally incapable of doing anything like that for the NHS, because we've got the structures of NICE and the structures of the MHRA mean that you can't, except in vaccines, use that advanced market commitment. So again, the councils that I find really interesting are the ones that are thinking about not just what do I want to buy to get me through today, but how can I establish demand signals about what I want to buy in the future and use that to drive innovation with my universities, with civil society, with business in my local area. I think anchor institutions in the future will be so much more ambitious than they have been in the past, where it has mostly been about trying to direct money to the local place. That's great. But what about directing money to the things that don't exist yet that we so critically need? And then my final thought is not about something that's a strategy function, it's just about growth. Is that I think, and Simon's really good on this, so you can listen to him too, is I think we've got so obsessed with thinking that local government's role is to make sure that growth is inclusive, that some of the role of local government in place in just driving growth has been lost. So a recent thing was set up called the Growth and Reform Network, and I went to a meeting of it, and they didn't talk about growth. I thought, isn't that a bit weird? Because growth is absolutely critical. Again, it's very easy when you are not national government, if you're local government, if you are Welsh, Scottish, Northern Ireland government, to get into the kind of victim mentality of feeling like your job is to spend money, it's somebody else's to make it. And that's partly because we have a highly centralised fiscal system, which is nuts, and we absolutely need to devolve fiscal power. Though I once wrote a speech for Nick Clegg in which he said that we were the most centralised country in Europe except for Malta, and we got a cross letter from the Maltese ambassador telling us that that is not true. So, worse than Malta. So obviously we need to change those things, but the reality is we absolutely need to get engaged in growing our way out of our financial problems. It is the only way that the demographic bulge of our ageing population can be resolved. And so yes, we need to rethink retirement, and we need to rethink where we build houses, and frankly just get over ourselves and some of the stuff that's paralysed us in the years that have gone by.
Thank you. Thank you very much, Polly. These two are going to get a bit of an advantage to you, but I do have a question for all three of you. More broadly, it says, and ignoring fiscal constraints, what do you see and how do you see councils in about 10 years' time?
I just said it, didn't I?
No.
Doing all of that.
You did, and I've got lots of questions to ask you about what you just said, but as a broad overview of where do you think?
So I think councils will will have had to change radically, right? There's two pathways to that. One, I mean, we're about to go through the big reorganisation, lots of change, inevitable. It's perfectly possible that reform will win nationally and push through change that we can't articulate and decide exactly. There's not detailed plans for exactly what that would look like, but we can expect an aggressive restructuring of the state at some level, if that happens. And if it doesn't happen because of that, it must surely happen because this government manages to actually get to the point of being able to reform services. So I think that we can expect devolution of more power, and the answer that I would advocate is for councils to lead that conversation about growth in place, about market making, about identity, and just change things faster.
Yeah, I love the way that you've talked about growth. I think it's probably the most important thing that any council can do, and it's very complex how you get to that. Growth kind of requires cheap energy. We won't go there too much, but
So really cheap solar panels then?
from China.
Great.
We had a discussion beforehand about solar panels because it's a blight on Lincolnshire's land at the moment, and we battle.
It's an amazing way of fostering biodiversity and creating hybrid fields which can support both
You can see
crops and energy generation.
You can see the chat that we had. By the way, I love my tie. It's my favourite tie.
It's great. It's a good.
Thank you very much. So some things.
Give me a look. I'm sorry.
Should I go? Is it a little?
So you talked about planning for retirement. I've done that already, and it didn't pan out very well. I've worked hard.
Good. You don't look like you're 75.
I work hard. Well, I retired at 52, which was mad, which is why I'm
Fiscally
here.
irresponsible.
Yeah, probably right. I've got a wife that works very hard.
So all these people you see, drain, working age population, not contributing.
Hang on, I'm back working. I am back working, paying tax, so that's good. But yeah, change, I think, actually the strategy function that you talk about with regard to change, I think is really, really important, really interesting. And there are people in the room that I'll speak about afterwards, And yeah, I think I am probably, a lot of people in this room would think I am an irritation, so that is also quite healthy and quite useful. At this point, I'm going to bring Robert in. Hello, Robert, you still there?
Hello, I am.
Good. So, Robert, where do you think local councils sit within the larger national picture, i.e. NHS, the police, etc.? Where do you how important do you think local government is in comparison to entities like that?
Yeah. So first of all, a really huge apologies for not being there in person. I'm a single widowed parent, and my 10-year-old has been coughing all for the last 2 weeks, essentially, at like every 30 seconds. So I can't see your paisley tie quite on the video, but you may get a cameo from a naked 10-year-old, which I'm sure will enliven proceedings.
I'm glad it's blurred in the background then.
So yeah, I did sort of say, please get us someone else, but they said, no, we still want you. So, okay. I mean, there's a concept in economics called reveal preference, which is you should judge people not by what they say, but what they do. And it's very clear that the revealed preference of central government is not to give a damn about local government in this country. I mean, Polly says some really sort of inspiring things about change, but the blunt truth is that change in the public sector is so much easier when you have money. And councils and the local government sector has not had money. It absolutely bore the brunt of the austerity program in the 2010s. It's being crippled by the sort of four horsemen of the apocalypse that everyone in this room will know about. I mean, not applying differently in different places, but essentially, certain statutory obligations, especially for care, that have landed on councils, which they can't really do much about. And more broadly, the story of the 20th century in the UK is a transition from a situation in which local councils and local government controlled 90% of the money that they were spending to one in which they controlled 10% of the money they were spending. So the Nick Clegg-Malta point is completely right. We are the most centralised country in the Western world, and it hasn't really done us much good. One of the points I tend to make is people say, why does America grow more than us? Why is China so impressive? One of the sort of secrets of those countries is that they have local and regional competition. If you're finding that the taxes in New York or California are a bit too high, if you hate all the solar panels that are appearing in the fields of Orange County, then you can decamp to Texas, you can decamp to Florida. There is likewise in China, that the sort of a huge engine of growth was essentially appointing people to run provinces and saying, look, your job is to make this place grow as fast as it can. And if you do well at that, then you get promoted to the Politburo. Like we have absolutely none of that mechanism, and I think that's so huge. So the result is a situation in which, and again, this will be familiar to everyone in the room. Councils are essentially being forced to deliver for central government without much autonomy about how they deliver it, and without much money to spend. I think I think one of the most encouraging things about the rise of reform, not just to flatter the chairman, but is
go ahead, please do.
The reform actually, the Tories and Labour have this is kind of brutal, but it's kind of true for the Tories and Labour. Quite a lot of what they see councils as is effectively is bodies to campaign and actively. If you take out the Conservative councillors, you're taking out, at this point, a very large part of the people who actually knock on doors for the Conservative Party. Which not only sort of makes them reluctant to reform in certain ways, especially ways which would involve merging and combining functions and sort of cutting the number of councillors, but also it sort of shows that. They haven't really thought about local government in terms of what it can and actually should do. The thing with reform is because they need to prove they can run stuff, they need to prove they can be trusted, and they need to sort of build up that army of they need to find that if they are going to take power, they are going to need to find 600 parliamentary candidates, 350 good MPs, another couple of hundred peers, if you want to flood the Lords and stop them blocking everything you do, including some who you're going to put directly in the cabinet. You need you need party chairmen, you need active. So you need this huge group of people you need this huge talent pipeline, and I think they are seeing local councils and local government not just as a sort of proof to the nation that they can run things, but also as the sort of logical place for that to come in. So that if you sign up and say I want to get involved, the first thing they'll say is, well, great, why not go and try and stand for council, run your council, and if you do well at that, then we'll have actual, because we don't know anything about you, we'll have actual evidence that you're good at this, and can go upwards. And I think that's a sort of useful thing. Away from the sort of the headline overall situation, I think I was asked sort of what does central government think of councils and how do they fit with its priorities, and it's tricky. I think one of the things which has disappointed me most about the government is, my pet area is housing policy, and one of the things that's disappointed me most about the government is that that if you're going to try and have a housing revolution, then you need to have a housing revolution. That needs to be your absolute focus. I could not understand it. When it may be a very good idea to merge councils together into unitaries and do all of that. I think it's a spectacularly stupid idea when you're overriding ambition, when you're saying that the thing we want to do most of all is to build 1.5 million houses. If you want 1.5 million houses under the current planning system, again, everyone in this room knows this, apologies, you need a pipeline of planning permissions and planning consents. That means you need local plans in place. That means you need councils to have the time and resources to sit down and write local plans. What instead you have in quite a lot of places is a situation where essentially, because the councils aren't going to exist in their current form, because no one knows which of the planning officers are going to kind of keep their job once this all shakes down. There's absolutely no incentive to get that process underway, especially given as we all know, councils that approve huge amounts of new housing tend not to get really rewarded for it at the ballot box. So, and also, even post-merger, I was, planning to, every survey that comes out of I mean, the LGA do quite a lot of this, but every survey I've seen on sort of local government capacity, local government needs, says that there is a huge demand for planning officers. That planning is a real crunch point. Everyone kind of accepts this, and central government, in a sort of fairly typically British way, central government throws fairly tiny amounts of money at planning departments to try and get them to do stuff. I mean, but like one of the sort of main reasons that there's a planning crisis is to talk to Polly's point about reform. It's a really bad job to do because the software that people are using is pretty antiquated. I mean, I'm not. I was talking to some guys recently who were trying to sort of bring AI to the planning system. Their kind of rough estimate from the planners they talked to was that 60 to 70% of planners' time is spent just doing, like, literally sort of printing out PDFs or trying to transfer documents from one incompatible computer system to another, especially where you've already had mergers and you've got 3 or 4 different software systems all in the same department, and no one's had the money or the time or the resources to straighten it out. So I think I am hugely admiring of people who choose to work in government, but local government, but it absolutely is the kind of it does get the short end of the wedge in this country. So. And that kind of speaks to the point about what we want, what we sort of think the future looks like. And I think there are, I mean, the sad truth is, like, if you want to see the future, you should probably look at the past. And so the future for councils is probably more financial pressures, more burdens, more duties. There are 3, I would say, things that could and should be done in sort of different directions. One is effectively that you take, and this is the thing that, so I run the Centre for Policy Studies think tank, and one of our suggestions is to take care away from councils. So if you look back, especially elderly care, if you look back at the history of this, Margaret Thatcher's government got very alarmed that we were spending too much on social care for the elderly. That the spending was going up unsustainably. So what they did was they transferred responsibility for elderly social care to councils. Like it wasn't actually, it was sort of nationalised back in the old days. And what this did was that it massively disincentivized councils from investing in care homes, retirement housing, and other things, because, again, as everyone in this room knows, what happened was people started to see elderly people as a cost, a direct cost on their budget. If you had too many old people, they weren't paying taxes, they were consuming goods. That was really, really bad for your accounts. So you can see this sort of this really striking drop. One of the reasons our care homes are so, we don't have enough of them. They are extremely dilapidated. They are is because essentially we almost overnight, when that change happened, we stopped building care homes. The other version of this, which a colleague of mine, not a colleague of mine, but some friend of mine suggested, is actually completely the opposite. That because so much of what councils are doing now in budgetary terms is related to care in different ways, you actually just make councils care organisations, and then you hive off all the other stuff that they've been doing. And I think those are both sort of intellectually credible things to do. I think that the second one would probably seem a bit weird to the voters and quite hard to explain to them. But I think it's really hard to run. It's really hard to run a council. It's really hard to be trying to do bold, agile change and all the other things that people need to do when essentially you have a sort of 5-ton weight strapped to your feet, which is the situation councils are currently in. So just by nationalising the funding for care, rather than you don't have to actually sort of change who's delivering cares. You don't have to change that, but just getting that cost off councils' books, I think would be sort of quite, especially for starting with the elderly, would be quite transformative. And the other thing, I mean, Polly has already mentioned this, is that we need to devolve. We need serious incentives for councils to grow and to make their own decisions and to compete with each other. There is basically councils have control, sort of actual control of pretty much none of the taxes they raise. I mean, they have a sort of tiny, they can sort of bid to raise certain taxes by a certain very strictly prohibited amount, but they can't really do anything bold or radical. But also, they don't get any of the, if they do encouraging pro-growth things, they don't really get any of the rewards for it. One of the sort of best development models around the world is pretty simple, which is that if you approve development, if you approve, if you create new tax revenues, then you get to keep those tax revenues. I mean, it's Waitrose or Tesco or Lidl try to attract more customers because they get the benefits of those customers spending more money with them. We have absolutely nothing like that in our local government system, and I think that is like one of the most, there's that classic Warren Buffett quote. If show me where the incentives are, and I'll show you the results. Or also Charlie Munger, who is Buffett's business partner. And I think we need incentives, as Polly was saying, we need incentives that let councils basically make good decisions in the national interest and benefit from them themselves. So sorry, that's a bit of a rant, but
no, that's fine. There's an awful lot that I could get back at, but I'm mindful of the time, so I want to bring Simon in now. Mayors, we have a mayor, newly appointed mayor at the same time as we took over the council. How do you think that's going to develop? Not Andrea specifically, but the mayoralties as a general.
I'm going to go up to the
podium. Yeah, go for it.
Because otherwise I think I will be the weird outlier now that the tone has been set by podium people. So I'm going to run up there.
You're not always the weird outlier.
Yeah, no, well, it's an occupation.
I feel like for counties they could be called sheriffs. Don't you think it'd be better?
That was what police and crime commissioners were meant to be, sheriffs.
What?
Police and crime commissioners were meant to be sheriffs. There was send for the sheriffs was the policy paper that proposed them.
Sheriff of Nottingham's got a bit of a bad brand, but sheriff's better than mayor for a county, don't you think, Simon?
We've been talking about governors recently, and everyone shouted at us when we said that. Look, let me start by saying thank you so much for having me on or back on. Akash's loss is definitely my gain, and it means that I get to do this panel without pushing anyone into the lake out there, which is a clear advantage of the situation. I'm Simon Kay from the think tank Restate, which until quite recently had a different name.
What was that?
We were quite happily called the think tank Reform for about 21 years, and then something happened. But we won't linger on that.
I promise I won't set up a political party called Restate.
That would be...
How about that?
That would be... well, I mean, there's literally nothing I can do to stop you, as I found out.
As you know now.
Exactly, as I now know. And it's a privilege to follow these other panelists. They have no way of knowing this, but they're often the voices in the back of my head, whether through some kind of podcast or an article that I've read or a really interesting op-ed. So it's a little bit surreal to be joining them. So I'm going to keep my remarks pretty short, and it is all about devolution. It's about the creation of the mayoral position. In fact, we're having an event with Andrea Jenkins this very Friday, if anyone wants to tune in for that. I guess the proposition I want to put to the room and to the other panelists is the idea that we're at a fork in the road, and conveniently the fork is something like the two sort of possibilities that have been framed out by the other speakers today. We are a cat in a box in Schrodinger's living room when we talk about the local state right now. We've never had a moment of more radical possibility and more radical activity emanating from central government. The revealed preference of this government, and indeed the last one, has been to at least tinker with the structures of the local state. And depending on your point of view, they're doing it too much or not enough or in the wrong direction or too fast but in the right direction. In the end, it's the fact of change that we all have to deal with and the situation of massive uncertainty. So what are the two different paths that we're facing in this fork in the road? Well, my view is that in the end they revolve around whether or not we can satisfy some kind of new settlement around the implicit social contract that the state serves. Well, the state at any scale. But I think if we're to point to what's going on nationally right now, and I think probably also globally as well, we're talking about a challenge to, a threat to, a disintegration of the basic elements of a social contract that's been in place since at least the Second World War, arguably for longer. And that dissolving of trust in institutions, that collapse of confidence in the abilities of the state to deliver, is founded on the everyday evidence of troubled public services, what appeared to be deceitful politicians at all sorts of different scales. And the result is playing out around us right now. So the future of the local state in 10 years or 20 years or 30 or whatever is going to revolve around the extent to which the state has an answer to the questions that are being raised of it, the challenge that is being put to it, about whether it can rebuild that social contract. At the core of the contract is a very simple idea, which is that we pool our resources, we pool our risk, and we say, I understand that by contributing to this structure, it's very unlikely that I will be the person who will get the most benefit from that pooling. But I also benefit from the fact of that pooling because I'm part of the society that is upheld by the state. In our country, most of that happens at an incredibly centralized scale, as we've already heard. And I suppose one of my ideas here, and it's not a new idea by any means, and I know it's shared by many people here, is that because it's so centralized, it's not tangible to people. That you can strengthen it by bringing it closer to people. That you can bring it within an arm's length and maybe even put people's skin in the game a little bit more and begin to find ways to collectively rebuild the elements of that social contract. Now, that's not going to be easy, and it's going to happen in the context not only of disintegrating trust, but also in the context of impoverished finances, massive international challenges, growing, complexifying public service demand. And the people on the front line of all that are the people in this room and the people you work with. And that's not going to change anytime soon. So the challenge ahead of us is to understand our situation of uncertainty and try to blow on the dice so that in 10 years' time we can look back and say that things have improved. So the two paths before us, I think, are clear. If we continue on the current direction of travel, with the devolution program as it currently looks, the reorganization efforts as they currently are cast, demand where it is, the tax system as it is, I think actually the path of least resistance, as it were, is fairly clear. Local authorities will become more homogenous, more similar to each other through a process of reorganization. There will no longer be a part of the local state that doesn't have to think about social care, for example. They will become more similar to each other. And they will become specialists in those aspects of service delivery to which they have statutory responsibility. They will become the delivery commissioners, the delivery procurers, and the deliverers themselves, and that specialism will grow and grow because the scope and the capacity they need to do strategic things will either be drawn away to a new upper tier of strategic entities, if that program is delivered in full, or will simply not be possible to enact because of lack of resource, lack of capacity. The current structure of those strategic authorities is really interesting. The mayoral model has been proven to work pretty well in some contexts. It's designed around a template that was dreamed up primarily for Greater Manchester. And that means it's well tailored to an urban context with a clear economic core and a periphery that you need to connect effectively to that core and public services that you need to align behind it and all the rest of it. The list of objectives is clear, and the way that you need to build up a mayoralty to serve those objectives is pretty clear in a place like Greater Manchester. It is far less clear to me that that same model will operate very effectively in a place with lower population density, in a place with a broader geography, in a place with more rural, more coastal communities. It's much less clear to me that we can simply cookie-cutter the Manchester model in all sorts of different places and hope that it works well. I'm all for the effort to experiment and to try. So this is all a bit gloomy, and that's the left fork on this path we're facing ahead of us at this moment. And of course, it's in the gift of people in this room, and it's in the decisions of the folks in central government right now to help decide which path to take. So what if a bunch of decisions start being taken differently? Is there a potential to rescue that social contract by bringing decisions more fully toward public ownership so that they're closer to people? Is there potential to build up organic structures at either end of the bookends of how the local state currently operates? Because if strategic authorities are at once too big and too small, then we need entities that are larger and smaller. Big entities for big rural areas to think strategically, to do big thinking and delivery, and community-scale organizations worthy of the name. so that everyone understands what's going on in their neighbourhood and has some ownership of how that can work. All the policy action right now is happening in between those two poles of scale. But what if we started to think about the smallest and the largest scales as well? And what if this in turn unlocks further devolution, particularly fiscal devolution, which comes with as many risks for local systems as it does anything else, but would actually allow some degree of alignment between the public service and other responsibilities of the local state and the way that finances are raised. That could change the incentive structures so we get more experimentation locally, would enable more public service innovation and differentiation between places so that places become genuine public service laboratories that try things differently and sometimes fail and learn from each other, so that the whole country starts to innovate in new ways and perhaps even compete, as we've just heard. There will be difficulties under such a model. There will be places that get a tough deal as a result of it. But at the moment, the tough deal is nationalized. At the moment, the difficulty is collectively shared. And what I'm suggesting is that genuine devolution could start from this starting point with the mayoral model, which is going to transform the local state massively, and build further in the next 10 years so that we take the right path on that fork in the road. Thank you.
Thank you very much, Simon. I just wonder if the cat meows, does anybody hear it? Or does it not meow at all if it's not in the room? So, I'm very mindful that I promised to get you guys to be more interactive. We've chewed up a huge chunk of the session, but we're going to go straight to questions then. So is there anybody that has there's a question just there?
Hello, it's Colin Hay, Gloucestershire County Council. Just interested in what you were saying in the last bit, because I fear that the mayoral authorities that are being formed are too small. And I go back to...
Have you seen Greater Lincolnshire? It's enormous.
In terms of population.
Oh, I see.
And the Manchesters are going to be just so big compared to that in London. So just going back to when there was the referenda on Scotland and Wales, there was talk of English devolution being the regions. So it seems to me that those regions would be big enough in scale to be comparable to the Manchesters. They would have a voice which I don't think the mayors are going to have, and it could then attract significant amounts of money to then distribute to, whatever we're going to get, the counties in one form or another. So I just wanted to pose that question, really.
Simon, that's really one.
I think you're onto something. One of the reasons why I think there's a fair amount of skepticism in this room about the mayoral model is because I think a lot of people have in the back of their minds a county scale or just a county plus scale mayoral system. But I mean, it's a bit like what's happened in Cumbria. We've split up a county of fewer than, I think it's around 400,000 people. We've glued it back together again now with the mayoral strategic authority. And to the benefit of what and to the outcome of who? I mean, I'd be very interested to look at what it would be to unlock the incentives that would enable county-scale organisations to get on board with some kind of pan-regional structure. Because if it's not at the scale of a county, it's not actually a risk to the county-scale politics that currently exist. Over a larger jurisdiction, all sorts of things become possible. And I think there's going to be a bit of a path of desire that emerges with the new tier of strategic authorities, because they're going to have to glom together to get things done anyway. They're going to have to glom together in order to get transport off the ground in a meaningful way, big infrastructure projects, a lot of economic planning. That's all going to happen at a pan-regional scale. So we've done some work pretty similar to what you're suggesting.
Polly?
I mean, there's an alternative, right, which is just to make Gloucester a lot bigger. You want a voice, well, be a bigger city. I was born in Gloucester. I like Gloucester. I think we do sometimes sort of think that these things are fixed, right? Like there was a time when Manchester had 100,000 people in it. Like, why aren't we more ambitious? It's there's Tom Harwood, who, a political correspondent that I mostly disagree with on almost everything, but he's like, why can't we just have a country with 100 million people in it and be like chill about that? grow the places, build the solar panels, the houses. Like, why are we so focused on keeping things as they are? You know, I often think of one of the greatest books ever written, The Leopard by Giuseppe di Lampedusa, who wrote that everything needs to change so that everything can stay the same. You know, if you want Gloucester to be important, then make Gloucester important.
Robert?
Yeah.
Well, so first of all, I think I can sympathise with Reform think tank. The CPS think tank had been in existence for about 20 years before someone set up the Crown Prosecution Service. No one asked us. But I think, I mean, I'm attracted to the idea of regions, but I do think there's an important element of public consent here. So one of the best and one of my favourite pieces of research we ever did was a paper on local government reform called "Who Governs Britain?" And one of the things we asked was, we asked people to name every layer of government they thought existed above them, and we then compared it to their postcodes. And the number of people who accurately named every single layer of government above them was 0%. So, like, literally no one could say, yeah, I've got a combined authority. I think I've got an elected mayor, obviously an MP, parish council. I think I've got. So there's a real legibility problem, and I'd be sort of wary of making it worse. But the other point is that one of the other things that polling found, and other polling has found, is that the level of trust is closest to where you live. Essentially, no one trusts people in Westminster. They think they're all scum. Fraudulent, corrupt, all the rest of it. They sort of trust the people at the sort of county level, but they really trust the people in the local level. Like, the last vestige of trust in our electoral system is for your parish council. It's for the most local network of government available to you. And you might complain about it a huge amount, but at least you can kind of see it. You can see it, and it's comprehensible to you. I grew up in Oxfordshire. Oxfordshire as a county feels like the natural unit to me. I always remember, when they'd have the TV news, they put us in the southeast region, and we'd hate that, and then they put us in the central region, and we'd hate that, because we're not London, we're not Birmingham, we're Oxfordshire. And I think I can completely see the philosophical attraction of the regional model, but I do think it's much less legible to people in terms of where they actually live. But I also think quite a lot of the mayoralties we've had are just slightly ridiculous, and not, in terms of the lines they've tried to draw. Simon's completely right that, like, we took the Manchester model and then tried to apply it in places where it's probably not appropriate.
Yeah, I think you're right. My concern, though, is that if we go regional too much, if we go too big, we will continue to lose local democracy. And I talk about LGR every single day. It's one of the curses, that and bat tunnels. The big concern that I have is that we will lose local democracy. Your district councillors are the guys that are on the ground, and the thought of losing them, replacing them with one county or unitary authority councillor is very worrying for me. That's where I see it. And to put another layer in, or to replace that mayor's layer with an even bigger area, you lose even more of that local democracy. I would fear for that. But Colin, thank you for the question. We've got a question there with the blue jumper.
Thank you, Andrew Jarvis, Deputy Leader, Westmoreland and Furness. 500,000 in Cumbria, by the way. I think it builds on the last question. With the combination of districts into large unitaries, with the appointment or creation of combined authorities, some of which are regional, local government is becoming much more remote from residents. Are we losing the local in local government? Does it matter? And if it does, what should we do about it?
So, Polly, would you like to start this time?
My mother has just moved back to the UK from France. And
where they are?
Yeah. France has so many tiers of government. And it's so much better, in my view. You know, Robert's right about how much people hate Westminster, but they also hate like just sort of the sort of sense that the cost of politics is too high, and that politicians are dreadful people. And it was interesting that actually a big part of the campaign against regional assemblies was driven by the idea of just more politicians is inherently bad. It's certainly true that trying to kind of coordinate across public services that are kind of siloed by discipline and then siloed by layer as well is difficult. But for me, it's worth it for connection. So I'd be happy to pay more for politics, actually. My stepmother was a local councillor where I spent lots of my childhood in Wales. And, you know, just so connected, right? She just knew everything. She knew everyone. She could get a grant from this thing about the quarry to pay for that thing. And, you know, and I remember her saving lives because she changed the gritting strategy because she knew where the kids with disabilities who particularly needed hospital access, potentially in an emergency, she knew where they lived in the county of Powys, right? Like, that's the kind of engagement you get from elected politicians who have to go out and talk to people and who are at a level. We just have more politicians, more mayors, more layers, and then all just find a way to get along.
Gosh, I never thought I'd hear somebody say we need more politicians. I'm not sure that's necessarily the answer, but you might.
But you don't want to abolish any? You're worried about losing the district council there?
Yeah, I am. Yeah,
so you quite like politicians?
At that level. And I think coming back to the question, I think it's a risk, isn't it? It's a risk to us losing that level. And we have to work really hard. As the new unitary authorities, however that looks, I think it's really important that we work with the parish councils, the parish meetings, which is even the layer down from that, and we need to keep that local engagement. It's really, really important. Otherwise, you know, we genuinely do lose that local connectivity. So,
let me say something provocative, which is
go on.
I'm not sure we have local democracy now. We certainly have local elections. We certainly have local representatives. But we haven't really gone out of our way to define what we mean by democracy for a while, and I'm starting to wonder if that's because it's a little bit inconvenient if we do. Turnout is low. It's even lower for the new mayoral authorities. Turnout's a pretty important indicator of the health and legitimacy of a democratic system, but it's not the only one. The fact that public trust is collapsing, as we've been saying, is also a pretty interesting health indicator here. So is it important that we look at the smallest scales, the neighbourhood scales? Is it important that local government is local? Yes, it's important that local democracy is both local and democracy. How do we achieve that? Well, there's a few different routes through. The first is that we have to care about that smaller end of the scale. The French model is actually really interesting because part of what you're seeing there with that complexity is the idea of treating units of government like Lego bricks. So actually, you have a little tiny basic unit of government that's really neighbourhood scale, and then you glom them together when you need to answer a certain question. And then there's another kind of jurisdictional question that's a bit bigger, so you put together those sort of bits of the Lego bricks, and before you know it, you've got something that's much larger. It's more like a current district might be, and that goes all the way up in terms of scale up to the top layers of what the French system can look like. Some kind of system like that, of clustering, could serve local democracy quite well. Will it solve the problem of whether people know the name of their councillor, of whether they can name all the different tiers that sit above them? I have absolutely no idea. We were all here for the Finkelstein lecture after dinner last night, and he made it pretty clear that radical public ignorance is here to stay. It's a landscape feature of how this country works.
So, Robert, if I may, I'm just going to skip over to the last question because we've pretty much run out of time, but there's...
We're in the priority programme, and we live next door to Andy Burnham, King of the North in Greater Manchester. At the election that he recently was re-elected, he won every single of the 128 electoral wards, every single one across the whole of Greater Manchester. He's had a massive impact. It's one of the fastest growing economies in the country. Consistently year on year, delivering huge social housing gains. And what about us? Devolution. The word means down. the powers that are coming to strategic authorities have never been held in our regions or sub-regions locally in living memory. As we currently are the most centralised state in Europe other than Belarus, and we all know who Belarus are friends with. So it is powers that are coming down. But we believe in our area, Cheshire and Warrington, a concept called double devolution. And we are going to devolve the co-design and delivery of mainly place-based services, but not
Nick, I'm
exclusively
going to let you know we've got 2 minutes left.
Town and Parish Council consortia, because that will retain the link, the golden thread, all the way through the process, which will hopefully address some of the current concerns speakers have raised this morning. I just wanted to share that with you. We've recognised that, and we're trying to find a way to work through that to provide reassurance.
Thank you very much. I wonder if we'll get a letter from the Belarus ambassador complaining about that idea. Look, we are pretty much out of time. Robert, do you want to come back? Because I skipped you last time, just very quickly.
No, I think I can sort of agree with all that. Very happy with double devolution. I mean, the basic principle, power should be as close as possible to the people who, preferably in individuals' hands, if not in the next level up. France, but I think one of the things about France is that French local authorities are not just delivery agencies for the centre. I mean, what killed local democracy is the fact that it has become a delivery function for central government. And then, of course, if you say to central government, you need to give these people more power and experience and autonomy, they say, but they've never had that. The poor darlings, they wouldn't know what to do with it. So I think, but yeah, and if we had France's record of house building, I'd be very happy. They've outbuilt us every single year since about 1950.
Yeah, oh, absolutely. Right, that's it. We've got 40-odd seconds left, and it's terrifying to watch that tick away. But I'd just like to thank the guests and the speakers today. I hope it's been interesting for you. I hope you've enjoyed it. And I'd just like to take this opportunity to thank CCN. It's been a fantastic couple of days. And if we take what CCN does on the shoestring of staff and finances and transfer that into local government, we'll be well on the way to having a much stronger type of government. They are incredible, and I take my hat off to them. So thank you all very much. Hopefully, God willing, we'll see you all here next year. Thanks very much. Thank you, Polly.
No worries.
Well, nice to meet you.
My name's Nick Mannion, as you might have just heard. I'm the Labour leader of Cheshire East Council. From what I've learned today, it's the only Labour-led authority in the CCN at the moment. So we are a small but perfectly formed group, as we like to say.
No dissent.
Okay, this is the final session, the last leg. I started a couple of days ago introducing a rural workshop across the way on Sunday tea time. So we've got the closing session, and we're delighted to be joined by our former Health Secretary, Alan Milburn, who's going to deliver our closing address. Alan was a Member of Parliament for 18 years, and during that he was, amongst other roles, the Secretary of State for Health. He, after leaving politics in 2010, he was appointed by the Prime Minister to review and report on child poverty and social mobility, becoming Chair of the Commission for Social Mobility. More recently, he's worked with Wes Streeting on reforms at the Department of Health and Social Care. Alan's not a stranger to the CCN. He spoke 4 years ago, the first post-COVID conference. And so what we would say, if a week's a long time in politics, and we all know that, 4 years is a lifetime. So, as we know, local government continues to face a number of difficult issues relating to demand and cost pressures. And even if we're more likely in the breaks to talk about SEND rather than adult social care, but after this morning's presentation, that was quite thought-provoking, opportunities to local government have also changed, and that was in the session we've just heard, especially with regard to advances in technology, which are opening lots of opportunities for gains and efficiencies in the delivery. So whilst we're all aware that local government faces some real immediate challenges, we've talked about many of these, but hopefully Alan will be suitably upbeat, and so we can leave with a spring in our step when we return to our authorities this afternoon. So over to you, Alan.
Thank you. Thanks very much, Nick. That's quite a hard challenge, isn't it, in today's world, sort of, because there's so much more pessimism than optimism everywhere that you go. But anyway, I'll try. I'll do my best. Thank you for having me back, first of all. I hope you've had a good conference. I got asked a brilliant question by a friend of mine a few weeks ago. He said, do you think you normally know when you're in a fin de siècle moment, an end of cycle moment? And the honest answer to that is that you don't, because history normally moves quite slowly, iteratively. And then occasionally you wake up one day and you realize that something profound has changed. And I can remember only twice in my life where I've had that feeling, that something is profoundly changing. The first was at the back end of the 70s, because I'm so old now, I can remember that really well. So I was growing up in the Northeast, I was a young guy, I was getting involved in politics, I was very left-wing in those days. More left-wing than even Nick is, which is quite hard. Nick canvassed for me in Darlington, you know.
Yeah.
Yeah, I know. So he's responsible. Anyway, I was growing up, and Britain was a funny old place then, in the back end of the 70s. You know, we'd just been through the 3-day week, eating your meals by candlelight, not watching the telly, because the telly wasn't on. We'd just been in cap in hand to the IMF. Trade unions were extremely strong and always on strike. Everything was bureaucratized. Most stuff was nationalized. And it just felt like, I can remember feeling, something's got to give. And then Mrs. Thatcher came along, for better or for worse. At the time, I thought it was remarkably for worse. And there were a lot of downside consequences, you know, deindustrialization, mass unemployment, all of that, social division, and so on and so forth. But things changed. Everything changed. The economy became more liberated, enterprise took off, share ownership, home ownership expanded, all of those things. So there's upsides as well as downsides. The point is, the sort of paradigm changed, if you like, the politics and the way that people viewed society. So that was the first time. I can remember that feeling and then something happening. And the second time is now. Because the tectonic plates, I think, are moving and are irreversible. So I'm also old enough to have lived through 3 big changes. The first big change has been in geopolitics. I've lived through an era of the bipolar world, Russia versus America, Cold War, and all of that. And then we moved to a world of pretty unipolar. Remember, there were books being written 15 years ago about the end of history. Do you remember that? Triumph of capitalism. It was all over. Well, it doesn't look like that now, because we're in this multipolar world. China, which is an autocratic, authoritarian state. Rise of India, rise of Brazil. In time, probably the rise of Africa. And it's messy now. So we've gone through this bipolar, unipolar, multipolar world. And you can see it, by the way, in the way that everything's now fragmenting, you know. So I grew up in politics at a time of globalization, convergence in the world. We're now moving to divergence. So you can see it in, take an example which you've been discussing, energy policy. America's betting on fossil fuels, China's betting on green energy. You can take your pick. I know which I think will win in the long term. Short term might be different. Regulatory policy. Attitudes towards things like ESG are different in America from Europe, from China. So we're divergent. So the first big change has been the sort of geopolitical change. The second has been the economic change. And so, you know, the Thatcher-Reagan era from the late 70s through the 80s into the 90s of unfettered globalization, free trade, open borders, free movement of people. And then we've seen over the course of these last, really, 10, 15, probably more years, sort of a growing reaction to that, which is more protectionism, more nationalism, if you like. And Trump is often blamed for that. So it's all about President Trump. The truth is, President Trump is a symptom. He's not a cause. He's an accelerant of something that's been going on for very many years. And you can sort of trace the origins of that really to, I think, the global financial crisis back in 2007, 2008, where for the first time people and governments began to question the wisdom of the market. Because this was a spectacular market failure with huge consequences for our societies. And then it was accelerated by COVID and the pandemic because people began to look at, governments in particular, began to look at their supply chains and began to think, is it a really sensible idea that everything is outsourced, particularly to China? And do you not need to protect your strategically important industries, not least energy supply? So you've had this sort of growing tendency towards, you know, and you can see it in the current government's attitude towards industrial strategy. We're going to back some sectors because they're strategically important for the country, which would have been unimaginable in my time, because we basically believed in the primacy of the market and globalization. So that's the second big change that you've had. And the third big change is the social, because all of this is underpinned by social and attitudinal change. And so globalization basically worked. It particularly worked for the east of the world. 300 million fewer Chinese people living in poverty as a consequence of Deng Xiaoping's opening of the Chinese market to Western capitalism in 1978, which, by the way, is the biggest poverty alleviation program that the world has ever seen. We've never seen anything like it, at scale and at pace. And so it worked for the East. The problem is, in the West, it produces losers as well as winners. And those losers are concentrated both spatially and socially. So you see it in our country in the so-called Red Wall. You see it in America in the so-called Rust Belt. You see it in a unified Germany in the east of Germany, where people are feeling increasingly that the system, economically, socially, and politically, isn't working for them. The globalization and its benefits have actually passed them by. And by the way, that's grounded in, that feeling is real, and they're right. Look at the data. Our country's economy has grown by 0.5% on average since the global financial crisis. The trend is around 2%. So if we're growing at trend rate, we would be 40% better off today than is actually the case. So people feel poorer because they are. And inequality has grown because it has. Only 1 in 8 kids from a low-income background today will end up being a high-income earner as an adult. I've been incredibly lucky in my life. You know, I was raised by my mum. I didn't know my dad. I grew up on a council estate. I ended up in the cabinet. That's pretty lucky. I was born in 1958, which is the peak year of social mobility. I got really lucky. And I asked myself a sort of pretty difficult question, which is, can I imagine a kid today growing up on a council estate somewhere in the middle of County Durham that no one's ever heard of, ending up in the cabinet? I think the honest answer to that is probably not. And I think that's a tragedy and a waste. But it's happening. That is happening. It's real. So you put all of these things together, and of course, there's a mood for change. I got asked another brilliant question. I was speaking to a bunch of academics who they're always smarter than you are, obviously. And so I finished the speech, and this guy put his hand up and said, do you know what today is, Alan? Christ, it's some sort of anniversary that I've forgotten. I have no idea what it is. I said, I have no idea. What is it? He said, today is the slowest day of the rest of your life. Today is the slowest day of the rest of your life. What did he mean? He was talking about the pace of technological change. So if you think about it, think about what's happened in the last 5 years. You'll have all been talking about AI, because everybody at every conference is always talking about AI. AI didn't exist 5 years ago. We're in the foothills of this journey. Does anybody here believe that the next 5 years are going to be slower than the last 5? This is exponential. This change is happening at huge pace and at huge scale, with huge consequences for the world. And it's creating enormous opportunities. I'll come to that in a moment, but it's also very destabilizing for people, because people don't know what it means for their families, their communities, their jobs, their futures, their livelihoods, their kids. So you put all of this together, scale of change, pace of change, surprising that people feel discombobulated and insecure. You know that in every community, whichever political party you represent, you'll feel it out there. I feel it when I go and knock on doors. People now no longer know which end is up. So change is the currency in the world. And by the way, if anybody believes that we can go back to the future rather than forward to it, forget it. This is not going to stop. This is not a moment in time where it just is a hiatus of change. It isn't. It's going to continue and it's going to accelerate. Now, councils, you've been on the front line of that over the course of these last few years. Now, you've been on the front line of change. Local government reorganisation, governance change, planning reform, education reform, health reform, I hope, before too long, social care reform, dealing with these issues, SEND and so on. So you're not a stranger to change in local government. In fact, if you look at it, if you think back sort of 25 years, there's been a fundamental reinvention of the business model in local government. You've had to focus on what you're going to do and what you're not. Some things have become harder to do because of the fiscal position that everybody's faced. And so my message, I guess, today is that because change is a constant and is going to accelerate, for county councils in particular, you have to get a second wind for change. And more importantly than that, you have to become champions of it. And I say this for 3 reasons. The first is the fiscal position, which is obvious. As you're about to see when Rachel delivers her budget, God, it can't come soon enough, in less than 2 weeks' time. The fiscal position, look, you've got anemic economic growth, not just in the UK, but across the Western world. You know, the government's chosen an extremely odd KPI, which is to be the fastest growing economy in the G7. You have precisely 1/7 of control over that, by the way. That's why it's an odd KPI, but that's what they've chosen. It's fine. Actually, we are the second fastest growing economy in the G7, believe it or not, which tells you something both about the benchmark and about us. So, hey, Houston, we got a problem and it's entrenched. Low levels of economic growth mean low levels of tax revenue, mean low levels of public expenditure. And that's the dilemma that she and the government will face on the 26th of November. For this reason, the law of supply and demand isn't working. It stopped working The demands are outweighing the supply. Think about it. We live in an uncertain world. Mr. Putin and all of that, what we're seeing in our continent today. So of course, Mr. Trump is right to say that Europe should put its hand in its pocket and pay more for our own defence. We should. Absolutely. So we're spending 2.3% of GDP on defence at the moment. The aim of the government is to get to 2.5. The aim of NATO is to get 3.5%. That isn't billions, that's tens of billions. I think of this as a sort of metaphorical queue outside of Rachel's door. Everybody's carrying a placard and everybody wants a cheque. Nobody's saying less, everybody's demanding more. Okay? Social care, more. Health, more. Infrastructure, more. We're undercapitalised, we're under-digitalised as a nation, which is why, amongst other reasons, we have such low levels of growth. So of course, we all want more. Amongst other things, I'm a chancellor of a university. The business model's broken, guys. More. Higher education wants more. Everybody wants more. Nobody's demanding less. And there's a limit in taxes, as she's about to find, and in borrowing, as Mrs. Truss found. It isn't working. So what are we going to have to do? We're going to have to find a way. Of course, she'll raise taxes, and of course, she'll do what she can on containing public expenditure, etc. But the truth is, we are going to have a new mindset, which is how do we get more out for what we're putting in? Because the era of more, more, more is over. It's finished. Seriously, even if you got up to 2%, it's still finished. Because the demand side is just too strong, and the supply side is too weak. So that means that we've got to have a different value-based approach to how we get more out for what we put in. And local authorities genuinely are in the best position to do that because you are closest to the communities that you serve and you know what it is that is in their needs, in their interests. So the first reason is a fiscal reason. We're going to have to do change. The second reason is that the big challenges that the country faces today, whether it's creating jobs, building social cohesion, tackling crime, all of these things require more action locally than they do nationally. Honestly, the era of Whitehall knows best genuinely is over. It is. And so, tentatively, this government and the previous ones have stepped into the devolution space. Good. These are welcome steps, in my view, at least. I think it needs to go a lot further. I think the next frontier is all about fiscal devolution, okay, which is going to be hard for Treasury to accept. But that's where we need to go. Why? Because in the end, the changes that need to be made about integrating public services at a local level are going to happen at a local level, not at a national level. And why do they need to be integrated? Because the challenges that we face today about building cohesion, improving health, fighting crime, they require action on the part not of one institution, but of several. We've got to get out of, we operate really well in vertical channels. You know, as a government minister, I always felt reasonably confident that if I pulled the lever, something would happen. Not usually what I expected, by the way, but anyway, something would happen, right? But what we're hopeless at is the horizontal. Joining up like this. Which is why, actually, when Starmer came in with the idea of mission-based government, it was exactly the right idea. Unfortunately, that's fallen by the wayside. So they're going to have to rethink about all that. But you guys can do that. And the truth is, if we're going to tackle some of these really big things, for example, look, we need to move to a different economic model. Because the economic model, just of pure growth, isn't going to deliver what is needed, which is social cohesion and inclusion. If you're going to overcome the losers versus winners, we're going to have a model that works for more than just a few, or more than just one part of the country. We can't just simply build the British economic engine on the basis of growth in London and the South East. It's unsustainable, it's imbalanced, and it isn't getting the best out of every part of the country. So we're going to have to change that. So there's going to have to be a more inclusive model. What does that mean? We're going to have to focus on skills, on procurement, on planning. That's not one agency, it's a multitude of agencies. And by the way, it's going to require more than the state, whether it's the state as local government or national government. It's going to require employers and business. If we're going to tackle economic inactivity, the big scourge that we have today, 3 million people who are out of work, but not officially, they're out of work because they're sick. How are we going to do that? We've got to create a demand side so that employers want to employ these people. So I'm doing a review, as some of you know, at the moment about this scandal, as I think of it, of 1 million young people today who are not in education, employment and training. 1 million. When I tell people that, people are bamboozled, astonished, horrified, for a reason. This is 1 in 8 of all our young people, aged 16 to 24, who are not in a job, not in education, not in training for the prospect of a job. 50% of them are on benefit. Benefits are rising like that. It's not just the welfare bill that's unsustainable, it's a social model that will become unsustainable. If we write off this generation, so I'm doing this review for the government, for Pat McFadden and Bridget and Phillipson, Wes and everybody, to try to say, right, okay, what the hell is going on? What do we do about it? What we do about it is not just what we do, it's what employers do. And how can we make sure that employers are incentivized to employ more young people, for example? So the point about all of this is that whether it's improving health, and remember, 80% of that doesn't rely on the NHS. 80% of that ill health is caused by poor jobs, poor housing, and poor life chances. It's got nothing to do with the NHS. If we're going to do that, we're going to have more integration at a localized level. And if we're going to get ahead of the curve, whether it's of knife crime, family breakdown, or ill health, we have to get upstream, now downstream, and that requires organizations, institutions in civil society be convened locally, not nationally. And the best people to do that by far, because you have the democratic legitimacy to do that, are local authorities. So you've got a critical role, in my view, in catalyzing alliances for change. That's the second reason. I say that change has got to be on your agenda, big time. And the third reason is we've got a fundamental breakdown in trust in democracy. And it's getting worse amongst the young. Read the polling, read the data. Amongst young people's appetite for more authoritarian forms of government. Why? Because they think the democratic forms of government, whether local or national, are not working. This is really storing up trouble for the future. So how do we rebuild trust? We rebuild trust through engagement. So what we need is, sure, we need devolution, but devolution can't stop at the town hall or the county hall or indeed at the mayor's office. It's got to be embedded in communities and go down to citizens. If we're going to deal with these issues of regenerating neighbourhoods or improving health or fighting crime, that requires active citizens, not just active states. That's a responsibility for us. Nationally, it's a responsibility for you locally. Very often people say, well, there's no appetite for that amongst the public. If you look at one of the reasons why people think society is unfair, they think it's unfair because they're not engaged. This is not a failure of appetite on the part of the public, it's a failure of engagement on our part. So we did some really interesting polling. I do some work with PwC looking at what the appetite was in local communities, particularly disadvantaged ones, for engagement. 3 in 4 people want to have a say over their public services. 1 in 2 of them want to get involved in decision making. Now, you might think that's blessing or curse, but it tells you this view that it's somehow or other the biggest problem is that people aren't interested is just plain wrong. So we've got to move our model from one that is about consulting people to engaging them. Yeah? So I grew up in the West End of Newcastle, right, in an area called Benwell, which is a pretty poor area, when I was a teenager. And I still, I know people there and work with various charities there and so on and so forth. And I go back quite regularly. And I've watched over 50 years, I've watched estates built, same estate knocked down, same estate built, same estate knocked down. I've seen endless cycles over 50 years. I once asked a friend of mine who was an academic at Durham University to quantify the cost of that in a 2 square mile area of urban Britain. And it's hundreds of millions of pounds. And it's failed. Why did it fail? Because the communities who were supposed to be beneficiaries of it were never engaged in it. They were never part of the process of creating change. So that's why when local government does participatory budgeting, or when you think about how you can get assets owned by the community rather than by the council, these are forms of engagement that we've got to amplify and accelerate in the years to come, because they're about bringing people inside the tent rather than keeping them out. So these are 3 reasons, in my view, why change has got to happen and why councils has got to be part of it. To make those change happen, there is one final area, which is, I think, we've got to, and this is true for the whole public sector, by the way, we've got to change our mindset as leaders in the public sector from one that has been about how do we manage things to how do we change them. It can't be business as usual. We've got to do transformation. And the biggest asset that we have is our friend technology. Yeah. Data-led decision-making, automation, AI in service delivery. At the moment, when I look across, this is not a criticism particularly of you, it's a criticism of the whole public sector. We're far too tentative. When I compare what big corporates that I've sat on boards of or that I've worked with over very many years are doing compared with what we're doing, we're in the foothills and they're in the apex. And I know it's hard, but honestly, we've got to lean into this. So take my old area of health. If you look at what is happening there, the possibilities are boundless. The collision of data analytics and genomic science means that we should be able to move our whole model of healthcare from one that's been about diagnosing and then treating an illness to instead being about predicting and preventing it. That is going to happen in my lifetime. Indeed, it's starting to happen today. Now look, you might think I'm just a crazy optimist, okay? And believe me, if you've been in politics, you've got to be an optimist, you know that. But the reason I'm optimistic is I can see where the potential exists for a fundamental transformation in our business model in the public sector. I really believe that. And here, I think the mindset change is really important. We all fall into the same trap. You did it and I do it. Mm-hmm. Think about our lexicon. When we're talking of the issues that we face, we talk the language of challenge. No one ever talks about the opportunity.
Yeah, good point.
What's the biggest thing in short supply in the public sector? Think it's money? Think it's people? I think it's hope. I think it's a sense that there is no possibility anymore. Backs to the wall, try to keep things going, keep the plate spinning. Our job as leaders is not to generate fear, our job is to generate hope. For people working in the public sector and most importantly for the citizens and consumers that use it. So yeah, I am an optimist, it's true. I see the world today as every day bringing new turbulence. Sure. You never know what's going to happen next. But it's also bringing new opportunities. Our choice is, are we going to champion change or are we going to champion continuity? Okay? I think there's really no choice. This is an era of change. Our job, collectively, is to embrace it. And I think you're in a really strong position to do that. You're connected in local communities. You have the credibility that comes from a democratic mandate. And there are huge, huge opportunities before us. That's it. Thank you.
I'm always impressed when people can speak for half an hour without notes and never say once. Thank you, Alan. Some of our members were going. Okay, while Alan gets his breath back, we've got 15 minutes or so. I'm sure some of the points and principles Alan's raised have generated a few questions around the room. We know the format. If you can put your hand up and introduce yourself and say we've got 15 minutes, so let's keep the questions sharp and on point. At the front, sir.
Councillor David Hitchener, I'm from Herefordshire, small and perfectly formed. Thank you.
Is that you or the council?
I'll take your choice. You've mentioned 1 million people in NEETs, and you talked about AI. I see AI as an enormous threat to those kinds of businesses. So you have this commission. So what are the answers, please, Alan?
Well, we're just getting going. So we're trying to work it out. I mean, part of the issue is we don't really know why this is happening in the way that it is. And in particular, you know, we know what the correlations are. We know that low educational qualifications is the number one factor that leads people to being neat. We know that you've been in care. You're more liable to be. or there's been family estrangement or whatever. But the new kid on the block is the upsurge, and it genuinely is an upsurge in ill health, disability, particularly mental health and neurodivergence. Okay. And you see it. It's the same, what you guys are dealing with in SEND, we deal with, or I'm dealing with, as the consequences. And so I see this as there's a sort of conveyor belt, an escalator, if you like, of largely people have come from disadvantaged backgrounds, end up in schools which frankly don't work for them, get diagnosed early, rightly or wrongly, then get child DLA, disability living allowance, and then graduate onto PIP. And then you end on a lifetime of benefit. A lifetime of benefit, really? That's the best prospect for 1 million young people. It really isn't. So we've got to be able to diagnose it and understand it. And we really need to understand amongst young people in particular what is going on in their lives. 50% of these young people are on benefit and 50% aren't. So in particular, the half that aren't, we have low visibility about. So we need to understand a lot more in the first instance. And then we can think about solutions. My intuition is that this is a whole systems failure. And I don't just mean in education, and I don't just mean in skills, and I don't just mean in welfare, and I don't just mean in health, and I don't just mean in employment support. I mean across the piece. And it's a societal failure as well as a state failure. And you're right to say that there are downside consequences of an age of automation. Sure. But there'll be upsides as well. Every age of change that we've lived through economically, and this is the sort of, people call this the fourth industrial revolution, every time we've been through one of these industrial revolutions, historically, it's been turbulent, but we've come out in the end better rather than worse. The question is, how do you equip people to navigate their way through it? We can't stand King Canute light and stop it. It's impossible. And not, in my view, I'd argue, not desirable either, by the way. So we've got to think about how best we equip people to sort of navigate their way through, and I think that poses some questions for our education system and our skills system, for example. Poses questions at a very narrow level for our apprenticeship system. Got fewer young people as apprentices today than we had before when the levy was introduced. It's supposed to be for young people. So something's going on. But we need to look at this not in one sort of, as I say, not in one vertical silo. We've got to look at it in the horizontal. So you're right to press the warning bell, of course. There may well be downside consequences. But then we've got to work out, okay, if that is the case, what do we do to mitigate them? So we can put people on a different escalator. Because at the moment, the escalator is taking 1 million young people down. So the question is, how do you reverse that and have an escalator that takes people up? And that's got to be engaging with employers, communities, parents. We're all have a part to play in this. 1 million young people. That's what I'd call a cause, capital C. It's a cause. It has to be a cause for the country to address. We can't just say it's inevitable.
That's a huge agenda, isn't it? Cuts across everything. Towards the back.
Oh, Tim.
Leader of Surrey County Council. You talked about local government and how we've changed over the last 20 years or whatever. And you talked about the opportunity within the health system. And we need the health system to be a key partner of local government, not just on the delivery of health and social care. But do you agree that there's a deep cultural problem within the NHS that's going to prevent them from embracing that change and that opportunity?
So, thanks for the question, Tim. I think, look, there's definitely cultural, I'll be polite and say there's cultural dissonance between health and local government. Okay. I think that is absolutely true. Now, when people have tried to fix this previously, because the truth is we do have to better integrate, and we have to get, to use the phrase that people use, which is that we've got to shift leftwards. We've got to move upstream, more into prevention and early diagnosis, and technology is going to enable us to do that, as I was saying, and less into too many people ending up in hospital where they needn't be in the first place. So that's what we've got to do. We've got to do that because it'll produce better health outcomes, but it'll also produce better fiscal outcomes for the country. To do that, previous attempts have really focused on structural changes. And I've been part of this in the past, primary care trusts and care trusts, you remember those? All of that sort of stuff. And I think structural change has a part to play in this. But I guess what I learned as a minister is that the most powerful lever that you have is not structural change. The most powerful lever that you have is how you incentivize people through money. So when we were doing, all those years ago, when we were doing waiting lists, the thing that in trying to get waiting lists down, which we did, sort of massive fall in waiting times and waiting lists for people for hospital treatment, there are a lot of reforms, foundation trust, devolution, transparency, all of those sorts of things that we introduced, but the most powerful lever of all was how we used money to incentivize activity. And what we've got to think about is what are the financial incentives, both in local government and in the National Health Service, that incentivize individuals and institutions to keep people healthy and out of hospital. Because at the moment, the incentives operate in the reverse way. In that, sure, and we need to get the waiting list down, of course. It's a political and a clinical priority. But in the end, the waiting lists only become sustainable if we've sort of prevented people from getting ill in the first place. And that's a fundamental change. So actually, I think that if we rely purely on the structural lever, you'll get part of the way, and you'll exhort people to work together. Exhortation, in my experience, doesn't really work. Incentives tend to work. And I bring that, look, I've been very lucky in my life. I've worked 18 years in the public sector and been a leader there, and I've worked 16 years in the private sector since I left politics. And I tell you one thing that I've learned more than anything else about the private sector. In the end, the biggest lever is the incentive on the individual and on the institution. And we've got to bring that to bear as we're thinking about how do you overcome these cultural dissonances that exist and are a real barrier to achieving the better outcomes that we want to achieve, both in health and in monetary terms.
Indeed, we call it the National Health Service, but for decades it's treated sickness. And as you pointed out, we need to avoid people becoming sick, living in their own home. Again, is there any one change that local government can bring to that to help that paradigm shift to, for people to live better and longer? Somebody explained to me that we've just had the indices of multiple deprivation. And again, people live with chronic life-limiting sickness for far too long in some communities, where in other less disadvantaged communities, that's at the very end of their life.
Yep.
And obviously that's a massive restriction. So is there anything you would urge us as the local government sector to push for as part of the West Streetians changes?
So I think one is, so I'll give you a sort of, if you like, a strategic, and I'll give you a practical. So I think the strategic is we've got to create a care system which is fostering higher levels of independence rather than dependence. So if you think about it, every poll I've ever seen, when it asks older people where they want to die, it always gives the same answer. People want to die at home.
Yeah.
In their own environment, surrounded by their loved ones. And what do we manage to do? We manage to achieve precisely the reverse outcome. So they die in an institution, not in a home. Mm-hmm. Well, that's a hospital or a care home. That's a bad outcome. That's about dependence, not independence. So how are we going to, so that's the strategic. What is the objective that we're aiming for here? I think it's greater independence. What is the practical? I mean, I don't know whether this is, entirely true, but I've been very interested in whether there's an application of what we've learned in local government or the health service when it comes to personal payments.
Yeah.
Yep. So, I mean, you know, friends of mine with kids who've got a disability, the life changer for them has been a personal budget.
Yeah, because
where they get to choose the menu. They get to decide because they know the kid better than anybody else. You know, sorry, better than you and better than me. They just do. And look, there are some downsides and all of that, as there always are with these public policy measures. Nothing's ever a slam dunk, right? But one of the commitments that we made in the 10-year plan is that we want to extend that notion to people with a chronic condition.
Yeah.
Because the truth is, what's changed in healthcare fundamentally is that the biggest drivers now of cost are chronic conditions, diabetes, arthritis, dementia. These are conditions that live with people, unless we can find a cure, which we will in time for these things. And so what we've got to do is we've got to find a way of activating people themselves. You know, the food they eat, the exercise they take, the lifestyle that they choose, because these have a bearing on their condition. So how can we do that? So I think this is for me, this is an interesting frontier that we need to open up, and I think local government can help to take that further than it has. Okay. And I think we need to apply some of those lessons to the health service. I think in other words, there's things that the NHS can learn from local authorities, what local authorities have done. To Tim's point about the dissonance thing, you know, no one's smarter than anyone else. We've all got a shared problem. You know, you're all here, you're different political persuasions, I know. Right? But as you're all finding, it's the same challenges, guys. Might be different politics, might be different policies, but it's the same old challenges. And I would argue it's the same opportunities, and the question is, how do we learn from each other in order to sort of deal with the challenges and enhance the opportunities?
Okay, we've got a chance for one more question. There's a mic on its way.
Steve Jarvis, I'm the leader of Hertfordshire County Council.
Hi.
You mentioned the not entirely great track record of structural change in NHS, which the government still seems to think is worth trying. But it appears that the government's recipe for making local government more effective is structural change. Do you think they've got it wrong there as well?
I think there's a huge, thank you for that rather pointed question, Municipal Journal ready. So look, I think there's a huge risk. Look, local government reorganisation isn't local government reform. This isn't. It's what, in my new life, not my new life, but the life that I'm in as a business guy, it's more in the territory of M&A. That's what it is. And there are upsides from M&A and there's downsides from M&A. And the downside is this sort of distraction. You're all engaged in it, spending so much time working out boundaries. Great. So what is the challenge? The challenge is not the boundary. The challenge is the service. What's the most important thing? How do we change it? To Tim's point, how do we change the service? Not how the hell do we change the boundary? The challenges don't go away just because the boundary's changed. So, look, does it make sense to streamline? Sure, of course, always. There's always more efficiency, there's always more productivity to go at, right? You know, we're all suboptimum organizations. That's just the nature of it. Of course, so fine. And if local government reorganisation is a means to that end, tickety-boo. That's really helpful. But the fundamental question remains the fundamental question, which is how do we get to a place where we're providing services and interacting with citizens in a way that makes the model better and frankly more sustainable for the people that we serve. So.
Okay, we've got 1 minute to go. Any quick question that will require a yes or no from Alan?
Go for it.
One last question on the aisle.
Denise Turner-Stewart, Deputy Leader, Surrey County Council. I mean, I found your presentation deeply inspiring and engaging, and I'd like to think we're all optimists here, as you are, and you talked about hope, you talked about personal responsibility, you talked about community engagement. I think the biggest sadness for me right now is how a great deal of our population feel about our country. It's not just pride, it's this feeling of being helpless and, you know, lacking direction and being quite lost. Given your credentials, what would be the one thing that you would be saying to the people of this country right now? We would like to take that message out to the doorsteps and try and get everybody to feel more motivated, more engaged and more hopeful. Thank you.
I think you're absolutely right. I think that is the diagnostic. People feel a sense of despondency. I don't know whether that's the right word, but that's close to that. Sometimes despondency, sometimes anger. And I think our job is we've got to create a sense of possibility about the future. I mean, it's so interesting for me. Nobody talks about the future. We all talk about we're all locked into the present and the problems that we've all got, which are real, of course. But, you know, politics in the end is it's a contest of futures. Some people have this view, some people have that view. Where are we trying to take it? What's the destination point? So I think you've got to be able to paint a picture of what we could be like as a country. Right? And there's lots of things that are fundamentally strong about Britain. There really are. Right? And there's lots of things equally that are fundamentally weak that we've got to address. There's a sort of balance in this. Yeah? Not everything is broken, not everything is fantastic. So I think it is all about this. How do you create a sense and how do you engage with people in a way that gives them a sense of purpose, engagement, buy-in, but fundamentally of hope? Mm. Without hope, you're done for. We don't believe that it's going to be better today than tomorrow. What's the point?
And I think that's a really good point to wind up on. We've got to give people hope for the future, hope the future is going to be better, hope their circumstances are going to improve, and hope their communities are going to grow and thrive. On behalf of us all here, Alan, thank you very much.
Cool.
That's certainly been a magnificent 48 hours, and we've reached the end of the CCN Annual Conference 2025, and I must say it has really flown by. In closing our annual gathering, first I'd like to say thank you again to all our partners who have supported this event. I hope you also got the opportunity to engage with them and also with members who have come here from across the country. Thank you also to our strategic partners that also contributed to our plenary sessions and our workshops, providing some excellent insights that I'm sure we will all take away from this event. I also really need to thank the CCN team, particularly Simon Edwards, James Maker, Hannah Chard and James Holden. They put so much into getting us to this point and leading into the event. And they're also during the event, just making sure everything works. And they also make sure we have high-quality speakers, which I think we've all witnessed over the last 48 hours. And they do everything so professionally. So on behalf of us all, thank you very much. And putting on an event of this size, when you're just a small team of 8 or 9 people, is a really great achievement, especially when the CCN officers actually remain unrelentingly focused on lobbying government on the biggest issues that are facing all our member councils. And third, I need to also obviously thank you. Thank you for taking the time out of your very busy diaries. We're all busy back at base, but to come here and gather is really important. This is the first time since May's local elections this conference has provided an opportunity for us to all get together in person, both new colleagues and those who have been here before. And I hope, particularly for those who have been here for the first time, you actually recognise what a truly impressive event this is, and a really good opportunity to meet colleagues who've got like-minded issues and problems that we all face. So I certainly have enjoyed meeting many new faces and having the opportunity to talk to some old colleagues as well over the past 48 hours. And I think these contributions and these discussions with member councils across the plenary sessions and also downstairs in the bar give us some really valuable insight for the CCN to take away and will help us shape the advocacy going forward. Over the past couple of days, this conference has provided us collectively with the opportunity to debate and discuss key issues facing all our councils. And we've covered a lot of areas. We've covered a fairer funding review, planning reform, devolution, social care, SEND, the future of local government sector, all really big issues. And there's no doubt that there are many, many challenges lying ahead. But the network remains extremely positive about what our councils can and will do and what we can achieve together moving forward. We know over the next couple of days we are going to see some further details of major government plans, particularly on funding reforms. And that leads into a very busy winter period as well. And the CCN will absolutely remain laser-focused, responding to and supporting all our member councils in these really critical areas. Making our collective cross-party voice heard across Whitehall and beyond is so important, and the CCN will continue to do that. Now, a survey will come out to you by email shortly, asking you how you've got on, commenting on the two-day conference. So please do take part in that. That's really valuable feedback for the team. And also lunch will be served downstairs shortly. But once again, can I just thank you all for taking the time out of your busy schedules to come and join us here in Marlow. And please have a very safe journey home. And thank you very much.
Thank you, ladies and gentlemen, for attending CCN's Annual Conference 2025. Lunch is now served in the restaurant. We'd like to wish you a safe onward journey and look forward to seeing you all again next year.